In an uncertain world, understanding data is more important than ever. It can help organisations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organisations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organisations to put their future into their hands.
At SAS, we love bold questions, outrageous and impossible questions. The answers are waiting to be discovered because space isn't the new frontier. Data is. And with the right questions and the right analytics, we make data do amazing things. Like make the world safer, faster, healthier, and kinder. All we have to do is ask the data, analyze it, shape it, and make it work smarter for everyone, everywhere. With SAS, you can turn data into answers and ask the questions that move the world forward. SAS, curiosity forever.
AI in the enterprise is all the rage. But put the hype aside. How are today's organizations actually executing and seeing value from enterprise AI? Dataiku is the platform, democratizing access to data and enabling companies to build their own path to enterprise AI. To make enterprise AI a reality, Dataiku provides one simple user interface for data preparation, data exploration, automated machine learning, model deployment, AI monitoring, and management. Dataiku is built for everyone with robust features for both the code-free and the code-first. From business users and analysts to data scientists and engineers, Dataiku makes working with data faster and smarter. Each company's path to enterprise AI looks different, so Dataiku supports the creation of a spectrum of applications. Whether that means building out a self-serve analytics platform or fully operationalized AI integrated with business processes. No matter what the underlying changes in architecture or advancements in technology, Dataiku remains at the center, the cornerstone of data governance and responsible AI. Dataaiku's centralized, controlled, and elastic environment fuels exponential growth in the amount of data, the number of AI projects, and the number of people contributing to such projects. Dataiku, for every industry, every use case, and also for everyone. Discover your path to enterprise AI at dataiku.com.
People have got a unique thing about them, which is not only are they awesome technically, but they feel a sense of belonging. We genuinely call ourselves a family. Genic was started out of a desire to start something from scratch that tried to tackle the data market with a new and fresh approach.
Our vision is to never settle on a technology, to be constantly chasing the unicorn.
The space is moving really quickly, and we see it as our job to be aware of new things coming, and when they are good things, be able to introduce them to our clients.
Databricks is the data and AI company. We help data teams solve the world's toughest problems. They can't be solved in silos. They can't be solved by one person. We need all the data, all the science, all the brain power in one place on the only open, unified platform for data management, business analytics, and machine learning.
In an uncertain world, understanding data is more important than ever. It can help organizations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organizations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organizations to put their future into their hands.
At SAS, we love bold questions, outrageous and impossible questions. The answers are waiting to be discovered because space isn't the new frontier. Data is. And with the right questions and the right analytics, we make data do amazing things. Like make the world safer, faster, healthier, and kinder. All we have to do is ask the data, analyze it, shape it, and make it work smarter for everyone, everywhere. With SAS, you can turn data into answers and ask the questions that move the world forward. SAS, curiosity forever.
AI in the enterprise is all the rage. But put the hype aside. How are today's organizations actually executing and seeing value from enterprise AI? Dataiku is the platform, democratizing access to data and enabling companies to build their own path to enterprise AI. To make enterprise AI a reality, Dataiku provides one simple user interface for data preparation, data exploration, automated machine learning, model deployment, AI monitoring, and management. Dataiku is built for everyone with robust features for both the code-free and the code-first. From business users and analysts to data scientists and engineers, Dataiku makes working with data faster and smarter. Each company's path to enterprise AI looks different, so Dataiku supports the creation of a spectrum of applications. Whether that means building out a self-serve analytics platform or fully operationalized AI integrated with business processes. No matter what the underlying changes in architecture or advancements in technology, Dataiku remains at the center, the cornerstone of data governance and responsible AI. Dataiku's centralized, controlled, and elastic environment fuels exponential growth in the amount of data, the number of AI projects, and the number of people contributing to such projects. Dataiku, for every industry, every use case, and also for everyone. Discover your path to enterprise AI at Dataiku.
Welcome everybody to day 4 of the Melbourne Business Analytics Conference. I want to start the day by acknowledging on behalf of Melbourne Business School Centre for Business Analytics that we are meeting on the traditional land of the Kulin Nation, and I pay my respects to elders both past, present, and emerging, and the elders from other communities who may be here with us today in the audience. Welcome everybody, and day 4 is the finale of the Melbourne Business Analytics Conference. What a fabulous week it has been. It's been awesome to hear from outstanding speakers and learn so much from them. Turns out we still have a fabulous set of speakers today from whom we can learn immensely. I'm going to introduce my good friend Anthony Ogoni in a few minutes, but after that, he is going to introduce our first speaker of the day, Dr. Kutsai Kanutu, who is an infectious diseases physician, and it's an appropriate person to have here since we are talking about healthcare analytics, and Anthony's introduction of Kutsai will make that incredibly clear. We also have a number of other speakers. We've got Dr. Jenny George, my former colleague here, who's now the CEO of Converge International. We have Steve Remington. We have Professor Karen Verspo speaking. We have Mark Alexander speaking. We have Dr. Phil Smart speaking from the Austin Hospital. And then after which we are going to switch into the Datathon pitches, which is a terrific way to end this conference. 6 finalists, 4 open finalists, and 2 student finalists will be competing for over $25,000 in prize money. And it truly is something that you should attend and see what is being proposed by these terrific finalists at the Datathon competition. But before that, it's this morning, and it is my pleasure to introduce Anthony Ogoni, who is the Chief Data Officer of Bupa. Anthony is a dear friend of the Center for Business Analytics and me personally, and I met him. In fact, we were reminiscing just a few minutes ago when we last met, and we were remembering the breakfast that we had. Actually, it was a lunch that we had a number of years ago. It was about 7 years ago, and he has been an incredible support to us. But he's actually been a support to countless number of analytics professionals in this country. He set up the fraud analytics practice at National Australia Bank. He's also subsequently, he was at Seek, leading their global matching and AI practice. And now he's at Bupa, continuing to mentor professionals across Australia and people who have since moved overseas as well. So Anthony, with that, I welcome you to the stage, and thank you so much for everything that you do for the analytics community.
Thank you as well. It's a privilege to be involved. It's my great pleasure to introduce Dr. Kutsai Kanutu this morning. I've had to take copious notes because the depth and breadth of Dr. Kanutu's experience puts most people to shame. So if you'll just bear with me for the moment. Kutsai, up until recently, was the Deputy Chief Medical Information Officer, and her specialty is a focus in infectious disease, which gives us just the perfect person looking after information management and infectious disease. We couldn't have a more pertinent individual to discuss the state of the world as it is today. She's a champion of STEM and an acknowledged top 10 Australia CIO. Kutsai spent 15 years in the public sector focusing on patient care, research and digital health project management. And this year, the reason why she was up until recently the Chief Medical Information Officer, she's an executive MBA candidate. Unfortunately, that's at the University of Sydney Business School, but we will not hold that against her. Dr. Kanutu has a very keen interest in social justice and is nationally recognised for her contribution to refugee health and telemedicine initiatives. Recent career achievements include establishing the Royal Melbourne Hospital Telemedicine Service, awarded the Women's Agenda for Emerging Leaders Award, has received the Victorian Department of Health Award for Excellence in Culturally and Linguistically Diverse Care. Dr. Kanutu delights in working at the intersection of healthcare and technology to deliver outstanding patient outcomes and health system strategy, and as I said before, is the perfect presenter for the world we find ourselves in today. So could you please give a virtual welcome to Kutsai?
Thank you, Anthony. And I told you were going to nail my name pronunciation, and you did. Good morning, everybody out there virtually. So you will have received the abstract for this presentation. What I wanted to try and do was to essentially take you behind the scenes of some of the work that I do in the hospital very much embedded in the COVID world to try and reimagine what recovery from COVID could look like if we were to take the lead from healthcare and the things we saw and experienced and how they might inform recovery and spending around our rehabilitation from COVID. So I'll start with my favourite definition of healthcare. So this is One Health, and some of you will be familiar with it, and certainly in public health circles, it's been a very popular way of conceptualising our approach to healthcare and our understanding of it. Essentially making that link between interdisciplinary, multi-sectoral, collaborative management and leadership that really accounts for the fact that we as humans are embedded within an ecosystem, and within that ecosystem we need to consider plants, animals and our surrounds in the ways that we approach healthcare. And nowhere has this been more apparent than at the origins of this pandemic, where we really deeply recognise that it's our friction between human populations and the environment that has a really vast impact on disease propensity and also the health of populations at large. So I want to sort of start with that, my preferred representation of what healthcare and what health means to me. So let's go back in time. Some of you may not want to go there if you're from Melbourne. Right back to the beginning. So it was only actually 2 days, so the 16th of March last year, that the state of emergency was declared in the state of Victoria. And shortly after, we were plunged into lockdown number 1. I think everybody was very happy to be done with homeschooling. I certainly was. But then not long after, we were plunged into lockdown number 2, which lasted for a monstrous 112 days, at the end of which we were then all allowed out sort of in small numbers out to cafes again, only to be plunged into lockdown number 3 around Valentine's Day, heartbreaking. But then at the same time, we are now at a moment of significant hope and aspiration now that we have vaccines available, and that rollout is underway currently. So to orient you, I'll tell you about one of the jobs that I have, which is one of the lead clinicians for Hospital in the Home. So I thought a good way for me to represent to you the sorts of data and the sort of metrics that were really valuable or would be valuable to us in the hospital were around this space of Hospital in the Home. So I work there, which means that during lockdown I actually couldn't work from home because I was working in other people's homes. So I'd be out on the road visiting people all across Melbourne. Some of them were COVID affected, some of them were not, and really trying to prevent people from coming into hospital wherever possible. So I'm going to allow you to imagine you're out on the road with me. Whatever your favourite car is, you can imagine that in, and let's head out on the road. We're going to do 3 road visits today, and I'll show you what it was like for us last year. So chosen to take you first is to see Hans. He is an elderly gentleman, 84 years old, living in a residential aged care facility. If you have been to an aged care facility before, you'll know it sort of straddles that boundary between a motel and a hospital. So a very unusual space to visit if you haven't been there before. And I was seeing Hans for recovery from delirium. So he's a gentleman with dementia, and he'd had a recent urinary tract infection, and as a result of that had ended up quite confused and delirious. And we were really just seeing him to make sure that he was able to recover normally and allow the nursing home to feel comfortable that they sort of didn't need to get additional people in, because at that time they were really locking down significantly. And there were large numbers of facilities that actually were preventing the GPs themselves from visiting. So the hospital outreach service filled a very important gap for them in terms of allowing them to continue to provide some measure of medical support and outreach during the depths of lockdown. So when I'm 84, which is not too long away, I would imagine that what we had before COVID were a few conditions that I think are very much amenable to change from a data perspective and a data collection perspective. So some of you may be aware that currently there are actually no mandated nurse-patient ratios in private residential aged care facilities, which means that often you'll have nurses who are working incredibly hard with large numbers of patients with varying degrees of complexity, and I think that's untenable. And we've seen that in COVID with the number of people who died or became very unwell in aged care facilities, including staff members as well. So after what we've been through, I would like to see legislated ratios and workforce skill sets as well to be sort of benchmarked across the industry so that people have a really clear idea that the facilities that they are working in and the facilities that people are choosing to be placed in have a really good sense that the workforce is matched to the acuity of the patients within that facility. Aligned to that as well, there's quite poor visibility in terms of case mix and acuity within facilities. And I would like to envisage a stage where not only will we know within a facility how sick are the people who are there, what are their care needs, but also start to do some forecasting around, you know, if I'm in inner Melbourne, if I'm in North Melbourne, what proportion of the population are over the age of 65 and might need to go into care, and what would their care needs be once they reach that stage? One of the things that is really glaring when you're visiting aged care facilities is the variability in terms of digital maturity. So I think there's some recent research that's been done to suggest that about 40% of facilities still are not digitised at all, so very much working on paper. That makes it very hard for me as a clinician to be able to observe what has happened with a patient over time, short of flicking through pages and pages of paper notes. And if you're having to rely on some of the quality of my handwriting, might be difficult for you. So I would really like to see some minimum requirements in terms of design and implementation of healthcare IT within the aged care sector, and some of those changes are underway currently. The other particularly dangerous space I feel is around medication stewardship. So because facilities are working partially on paper, partially digitally, what you tend to have is paper charts where it's very difficult to understand why someone is on a medication, how long have they been on it for, or even which pharmacist those drugs are coming from and who I would need to contact to find out more detail. I strongly believe that we should have digitised and trackable medications prescribing and dosing within aged care facilities. For one, it would allow us, at a system level to actually look across a few aged care facilities and get an understanding of what this facility looks like it's using more of drug A, which might be a sedative drug. What does that tell us about what's happening within that facility, and how might we be able to change that or either address some staffing issues that are meaning that those sorts of prescribing patterns are emerging within that facility. So a real sense of quality and control and care of staff as well as care of patients within that context. So that's stop one. We're going to change vehicles now. So another car of your choosing that we popped into to visit our second patient. Patient is Greg. He lives in social housing. He has a disability secondary to a motor vehicle accident where he acquired an acquired brain injury. So we've been seeing him following a recent admission for mental illness, and he's now home. And we're really going to see him to make sure he's transitioned well and that he's linked back in with his regular community supports. So here's Greg. Now, many of you in Melbourne will remember that one of the hallmarks or one of the real sad moments in our lockdown number 2 was what transpired in the high-rise commission flats, not too far from here, actually, at the business school. Where we saw large numbers of people being essentially locked away for a period of time that for them would have felt quite indefinite at very short notice. This concept of, home and what home is something that really came to the fore within the context of COVID, because we realised that the ways that people live or the homes that they inhabit carry inherent risk, particularly in people who live within public housing where they often have to use shared facilities, and a lot of the social housing stock is significantly sort of decrepit, I would class it as being, and it's a real challenge to manage a public health disaster within that context. And that's something that I've seen very much in the refugee health space as well, with people often having to live in accommodation that's substandard because of the price of buying into the market, and then rising rents as well. So one thing I would like to see is that rather than us focusing on primary homelessness or park bench homelessness, I would like to see more data on secondary homelessness. So that's couch surfing, people who have to live on sofas or in crowded tenements because they're not able to get a lease by themselves or enter into the social housing market. And also tertiary homelessness, so people living in caravans, boarding houses, the sort of housing that we would consider long-term to be substandard. Again, there's currently limited visibility of the public housing waiting list. That should change, and it should also be gender disaggregated, because one of the things we've seen through COVID and before is that the rates of family violence and violence against women rose. And a lot of the drivers behind that, or one of the things that could temper that, would be access to housing for women who are at risk within locations that actually support them to continue their other, responsibilities, whether that's a carer duty, looking after children, etc. We have falling levels of social housing. I would hope to see that in future we would set minimum targets of what's an acceptable level of social housing within every local government area, and also some more options for people to actually buy, so more simplified rent to buy options for people wherever they find themselves. This is the second last stop before we get back to the hospital. Mrs. Chen, she lives in her own home with her daughter, who really acts as her main carer. So she recently had a bowel obstruction, and we are now seeing her at home because she really hasn't been eating very well since she got home, and she's still requiring some wound care. She's adorable. This is based on a real patient I saw, and my colleague and I went to visit her, and we both left and looked at each other and said, "Do you want her to be your grandmother?" And we went, "Yeah, I do. I'd love it. If I could borrow a grandmother, this is a woman that I would love to have as part of my family." So this final patient stop is really a discussion around language needs. So Mrs. Chen was Cantonese speaking, and the sad truth is that there is some data actually from Melbourne, a group in Melbourne and Canberra, ANU, that found that 1% of healthcare consults that actually required an interpreter ended up with one. 1%. I think we should be targeting 100%, because if somebody is turning up for an appointment and can't understand what is happening within that consultation, it doesn't serve them well at all. It's a significant risk, and it also doesn't serve the clinicians that are investing their time and expertise in supporting that person's healthcare. In terms of interpreter reporting requirements, they are patchy at best. So I have asked a lot of the interpreter agencies around, look, what are your reporting requirements if you're not actually able to meet a language need? And the response has tended to be, well, if we can't fill a need, we're not actually mandated to record that we haven't been able to meet a language need. That needs to change, because we need to actually understand what the full unmet need is within our community, particularly as we get more and more people who are coming from countries that represent emerging languages. And again, in the context of telehealth, the limited access to video interpreters when we're trying to push people towards video-based models is unacceptable. And I think we need some real strong benchmarking and then some roadmaps around how we can augment the technology that we have at the moment to bring interpreters in through various modalities. So my last stop, last Friday anyway, was my COVID vaccination. So another really data-rich space for us at the moment in terms of understanding how we are going to meaningfully recover. So as the last slide, I thought I'd share with you some data that's out of Oxford and our World in Data around where we are placed at the moment in terms of population fully vaccinated. So wildly varying numbers, and again, for the data nerds out there, you'll be asking yourselves a lot of really important questions around how do we know that this is factual, and how will we track a whole number of vaccine metrics as we go along, like vaccine wastage, who's actually received vaccine, who hasn't turned up, and how we ensure that we get a quality outcome from this extraordinarily exciting development in the pandemic. I will stop there and just finish by saying I think the most important thing I've learned through COVID is that data is only important if you actually intend to do something with it. And something that really pains me is collection of data in vain when we have no intent to actually use that information to improve healthcare and improve healthcare outcomes. And I think the numbers that we've seen through COVID suggest that for all the people who have died and suffered significantly, if we get the metrics right, we really put ourselves in a strong position to improve not only our lived experience now, but our future resilience to COVID pandemics and other pandemics that will inevitably come in the future. And I'll finish on that somber note. Thank you.
Thank you, Kudzai. I'm going to take the right-hand side. No, I'm going to drive. Yeah, you're staying right here with me. Just make sure we're both on screen. Good. So Q&A right now. I just remind people who are online, you can keep sending questions through while we do go through this Q&A. We finished 1 minute early, so we might get an extra question in. I'm going to hit you up with a first question, and that is, I really love the future world that you're trying to take us to. That future world is there to help, solve the problems that we know of today. Have you given any thought to, once we get there, if we build that capability, what's the other stuff that we can do leveraging that capability as the new baseline that we've never thought of?
Yeah, I think what it does allow you to do, it really allows you to start reimagining things like, how does workplace training look? So if I can see, for example, nursing home A has had a rise in patient acuity across their service, but they're kind of understaffed from a nursing perspective. That might allow you to look at that facility and go, okay, we've got a university linkage here. Rather than trying to recruit, and recruitment is really challenging, rather than trying to recruit a completely new, RN or a staff member, why don't we see if there's some way to do work integrated learning so we can upskill the staff that are there to try and address the need within the facility and have people who already know the system well enough. So what that information or that data should allow you to do is to really operationalise at pace and transition at pace if you suddenly detect, changes that might be temporary as well. It might just be a temporary need. But by understanding what your service looks like and being able to track it over time, it allows you to not only improve, tomorrow's shift. It allows you to say, look, this nurse who's fantastic and seems to manage this acuity really well is going to be on leave in December. Now that we can see what it's looking like, we're actually going to book ahead and get an additional person to, additional 2 people to fill that gap. So it's about that ability to respond that I think was sorely lacking in the pandemic, because we saw short-staffed facilities that didn't have PPE, and that's another thing as well, the procurement angle, understanding what people need. How much PPE would a facility with 60 beds need if they've got 20 staff? There's so much that you can do to prevent and preempt disaster when you can already see the lie of the land, and currently we're really working blind.
We spend a lot of time reacting, don't we?
Yeah.
It's actually very expensive to react. It's actually economical to be proactive and be predictive. Somebody's asked a question, and I guess most people here would be thinking along these lines. We would really love your learned thoughts on a vaccination passport for travel, or the no jab, no fly, or any other version of how we use the jab. What are your thoughts? Where do we get to?
I think some sort of vaccination passport is an inevitability now for a number of reasons. Number one, it builds confidence in business that they can restore, the airline industry. It provides a measure of comfort to government as well around what are the terms that allow people to come into the country or even to leave, particularly when we're trying to fill some significant workforce shortages or get students back in. So the international student, population back into the country. It's not without challenge though. So if you think about people who can't get vaccinated, so vaccination is not the same as immunisation. So there are some people who may well get vaccinated, but then when you check them to see if they've got antibodies, they won't have any. So what do you do with them? Do you say, well, because you didn't show any evidence of actual immunity, you can't come into the country? So there are going to be pockets of people in whom you're going to really have to have a nuanced approach to what you do. But I think in practical terms, because of the, and a lot of it is just about, shows of confidence and making people feel that there's some, flaw to the chaos that they've experienced. So it will happen, but I think people need to be mindful that it won't be a solve-all because of these, variations in context individually and also internationally. What if one of the vaccines emerges to be far better? Oh, so you can come in, but you've got a short visa because your vaccine, we're not 100% sure. There's so many things that might, come out in the wash. So everything with a grain of salt. Thank you.
I think we all know the answer to this, but we'll ask it anyway. In health, there's been a long tradition with biostats in research, genomics, etc. As data becomes more and more available in the health system, are you seeing a flight of data scientists to this industry, or are you experiencing a shortfall like everybody else? Would you love more data scientists?
I had a conversation this morning at 9 o'clock with our Director of Nursing Research, and she would love data scientists to flood her doors. Please do. Message me after. She'd love to chat to you because there's a real shortage. And I think part of that is that the worlds are they're separate worlds. So healthcare is very much it's a bit of a closed workshop. You work in healthcare and there's spaces that people don't just turn up to and I'm just going to have a look around the hospital, and data science still seems to feel like it either sits in a project, someone's doing an academic project, and we're certainly working on that. So we've got business intelligence unit, we've got, informaticians working within the hospital, but it's still not at that stage where, we're flooded and we, can knock on a door and say, hey, look, I want you to clean some data for me. It still feels like something that's outside that we're trying to sort of weave in meaningfully.
Okay. That's an open invitation to all the data scientists and analysts out there, except for the ones at Bupa. The telehealth, as telehealth has emerged as something that we're actually capable of doing. It was almost a myth prior to 2020. Where do you see telehealth going and digital healthcare?
Well, a few really big things on the horizon. So the MBS telehealth items were due to run out end of this month. That's now been extended to the end of financial year. So a lot of hospitals and, healthcare sector is waiting to see what's the signal from government around it. Are they going to support this? Are they going to support phone? Are they going to support video? A bit of both? Are they going to scale it back so that it's specific targeted cohorts again? So I think a lot of it relies on that because the funding models have really been around, being publicly funded rather than privately funded up until now. So that will be the key thing that's sort of next in the roadmap of where do we go after this. I don't think there's any debate around the utility and how helpful it has been in a lot of contexts to keep people safe, to keep hospital spaces safe as well. But there's a lot of work to be done in terms of really reckoning with, from what we learnt and what we experienced, what sort of consultations really worked well for telehealth? What were the really good experiences and where were the ones that were, suboptimal? And I've spoken about language needs. Language needs for me, feels just a bit of a mess. So there are lots of things that need to be improved regardless of whether or not the funding comes along. There are things we can work on, but the key thing is going to be, is there money available to support this kind of work going on?
And I wonder if the AI that allows real-time translation from one language to another might actually be an enabler when you speak about language in a digital environment. It certainly is something worth exploring. We might have time for one, maybe two more questions. Let's see. There was a question here about vulnerable populations and probably and remote populations. Could we speak a little bit more about how data and analytics could help in that world beyond just telehealth? Yeah.
So what I like to say to people is we'd like to talk about vulnerable people, but what we really should be talking about is about perilous places. So we often create environments that make people vulnerable. People don't wake up in the morning, oh, look at me, I'm vulnerable, but we tend to create situations where people are more likely to slide. So a lot of the focus of the presentation I had there was around, it's actually allowing us to identify what are those perilous places so that we can improve them to support people. And a perilous place can be, you know, a local GP practice where there's no capacity for bulk billing, and it's, you know, New Year's Eve or New Year's Day, and the only place you can get care on that day would either be I'm going to hospital emergency department, or I can't afford to pay, or I can't afford to pay for dental. So those are the kind of metrics that I'd like to see, you know, more sort of mapped at national level. And there was a question there around, you know, what are the national sorts of metrics that we need to be looking at? And for vulnerable populations, it's often that. It's like, what's the density of ear, nose and throat specialists who bulk bill in this area? How far would I need to travel if I needed to see, you know, a rheumatologist, or if I needed to see a speech pathologist? Those kind of metrics that allow you to really zoom in, get really granular. So if I'm choosing where to live, or trying to understand how safe it will be to settle a refugee family in a community, do I know enough about that population and their demographic to make really good judgments about where families should be going when they're arriving in this country? So it's trying to match what we know about places and environments with what we know about people and some of the, you know, challenges that they might have coming into those environments.
And so then last question, you're trying to drive a whole bunch of really positive change. What are the blockers? And as citizens, what could we be doing to help you push that agenda forward?
Yeah. I feel like sometimes we in healthcare think very much at the bedside, and there is a real move with a lot of organisations to be a little bit more vocal in their advocacy. So, you know, wherever you're working, there will always be opportunities for those discussions around, you know, what projects are we working on, and being really clear about what is the population that you're serving. Wherever you are, you can ask yourself that question. You can be working at the supermarket. You ask yourself, who are we actually serving here, and are we serving everybody equally? And if people can even just have that question in their minds as they're going about their day-to-day work wherever they are, it allows you to have those moments to choose to advocate or choose to do better. And that's whether it's at the voting booth, whether it's, you know, when buying an item off the shelf. Who am I serving by buying this thing? Where does the money end up going? So I think it's about just building it in. You know, there's this whole thing about mindful moments. I think there are advocacy moments that we all have in the work that we do and as we go about our lives. So that's the best you can do.
Great. We will stop there. I want to thank you twice. I want to thank you for coming in today and presenting just a compelling vision of where we can get to. It's been fantastic. But on behalf of everybody, both in this room and you know, down the camera, for being one of those few people as the rest of the world was running away from the danger last year, you were running headlong into it, so I want to thank you for that as well. We are going to take a 2-minute break, everybody, while we set up for the panel. We'll see you in a moment.
Well, welcome back to the panel discussion. I'm delighted to introduce you to the moderator of the panel discussion, who is Associate Professor Jenny George, who was my former colleague at Melbourne Business School, in fact was the Dean of the Melbourne Business School, but now is in a very different role as the Chief Executive Officer of Converge International. You folks might know of Converge International, but if you don't, it is an employee assistance program company, and it has done extraordinarily well in these difficult times, obviously, because these are difficult times where we do need assistance from folks like, who work at Converge International. Jenny's had a very long career in academia and a fabulous career in academia. She did a PhD at Stanford a number of years ago, after which she moved to Melbourne Business School, where she's been an absolutely extraordinary academic. She also, in her most recent role at Melbourne Business School, led the Master of Business Analytics program as academic director, and that was the first year of the program. So we have much to thank Jenny for the incredible success of the program. With that, I'm going to hand it over to Jenny, and she will take you through the panel discussion. Jenny, welcome.
Thank you so much, Ujwal. It's just wonderful having you all with us. And we have a number of really distinguished panel guests here. Steve, I'm going to throw to you first, and I'm hoping that each of you can just slightly introduce yourselves as we go. So, Steve, you've had a lot of experience with healthcare analytics, and particularly with the operational aspects of that. Can you tell us a little bit about your role and what you've been seeing in the healthcare sector with particularly operational analytics?
Yeah, thanks, Jenny. So I'm the founder and principal consultant of a analytics consultancy called Monera, and a number of our clients have worked in the healthcare arena. And what we've found is, and a lot of my background is just general process analytics and workflow analytics. And what we found was that it's actually really important for service delivery for healthcare providers to be efficient in the same way that a factory or a back office processing is efficient. And some of the examples we had just recently was working with a hospital group in Europe where they were getting, in a sense, surprises with patient flow through their emergency group. And, you know, patients coming through reasonably quickly, reasonable steady flow, and then suddenly there's a spike. And sometimes they can't deal with those spikes because they're not ready for the downstream impact. And that the patient manager that we were talking to at this hospital was saying it can take us 2 to 3 days to recover from one spike at 2 o'clock in the morning on a Saturday. And so what we were working with them to do was to try and help predict, not so much predict the spike, but make them aware earlier that the spike had occurred or is looking like it might occur. But also provide them with analysis to say, it's almost like, should I care about this spike? So if you've got a spike of low acuity patients, maybe they've broken their ankle, they get some painkillers, they get a cast, and they're sent home, that's fine, you don't have to deal with it. But if your spike is middle of winter, elderly patients, respiratory problems, they're probably going to be spending 2 or 3 days at least in the inpatient wards. How do you make those beds available so you don't have this situation where old Mrs. Smith or old Mr. Jones is lying on a bed in a trolley in a hallway? And the patient manager was saying, if we can get an hour's notice, we can send some people home a few hours earlier from the inpatient ward. They were going home anyway, but you know their partner was going to pick them up at the end of the day. But hey, can we send them home at lunchtime? Or can we call in extra nursing staff or extra medical staff to deal with that backlog before it clogs up the hospital? And so looking at sort of real-time time series analysis of these cases, and we know what they are. They get triaged. We know that it's a high acuity, low acuity, male, female, underlying conditions, whatever it be, but that information just doesn't get disseminated into the operational staff of the hospital to prepare for it or ignore it. It's like, oh yeah, we'll have a lull in a couple of hours normally, so it'll just wash through, or oh my, I have to prepare for it.
And it's interesting how those operational details, in a way, also then affect access and affect the actual delivery of great healthcare to the people that you're trying to get it to. And could say, we've obviously just heard from you about all the great work that you're doing. So in a way, you need no introduction. But if you just want to talk a little bit again, because I know access to healthcare is obviously a huge thing that you're involved in. How does that work out? And I suppose going beyond what you just talked about with telehealth, where are you seeing, if you had all the money in the world, all the resources of the government, where would you put it to ensure good access? Are the operational kind of efficiencies that Steve's been talking about, where we really need the money to go? Where else do we need to ensure good access?
Yeah. It's an interesting point you made around, fluctuations in bed flow. So I think at the beginning of the pandemic, they estimated there were 2,400 ICU beds in the whole country, but at surge, they expected they'd need 35,000 a day. So how do you prepare for that, right? It's a bit,
scary.
It's scary. And the best they could do was to try and forecast for 7,000 additional beds. But when we talk about even access to those beds, someone needs to look after a patient in an ICU bed. You don't just make a bed and go, there you go. There's so much more that needs to come before that access is actually meaningful access. So when I'm talking about meaningful access, I'm thinking about, by virtue of having this resource available, is it available in a way that meets the patient's needs? So is it well located? So if we use the vaccine drive as an example of, what's possible if we had a lot of money, you would hope that for anyone in Australia, they don't have to travel more than, 2 or 3 kilometres to get their vaccination done. And if they have a problem, that they don't have to travel much further in order to get that addressed. So it's really about getting to a point where you can see some measure of equitable, meaningful access for people regardless of where they live. And even if you can't, you should at least be able to baseline that. Because I think the biggest challenge at the moment is that we can't even see the issues. Like you said, we can't even see it, and we've not put in the effort to start visualizing, because it's scary as well, I think, for government or everyone to say, yeah, we've mapped it and it's horrific. Like, we are going to need lots of money. And that's why we unfortunately end up in a situation where we have a disaster and then you end up with a Royal Commission that goes, here it is. This is the awfulness. And I think what we'd hope or aspire to if we had the money is that we have the confidence and we're bold enough to out it before we end up with the Royal Commission, because that's a very terrible, hard endpoint. Or let's wait for a catastrophe and then we get lawyers and people to, rake through the bones and the coals.
Yeah. There was a very quick example of that in New South Wales recently, where we had this couple of mini outbreaks, and they were in lower income suburbs, and they had, everybody go get tested, everybody go get tested. But all of these testing areas were not near public transport. Yeah. So most of these people didn't have a car to go and wait and queue up. And suddenly the government, oh damn, hang on a minute. We'll set it up in the local school, which was closed, which was in 5 minutes walk from a train station. Yeah. And suddenly there was a surge of people from this area getting tested, not because they didn't want to, just because they couldn't.
Yeah. And in terms of access, obviously, sometimes there are challenges just with having the right information. And we know that getting the data, collecting it and aggregating it is a big issue. Karen, this is something that I know is dear to your heart. So, Karen, do you want to introduce yourself a little bit and where you're coming from, but also what do we need to do about access to data sets to enable us to answer these kinds of questions?
Yeah, sure, absolutely. It's critical to have access to the data. So, I'm currently the Dean of the School of Computing Technologies at RMIT University. And I have a long history of research in the area of AI in medicine. And one of the key things that I've focused on is actually the unstructured data that's available in the electronic health record system, and trying to leverage text analytics and natural language processing to try to surface some of the information that's in there. But the starting point, of course, is access to those electronic health record systems. And, to your point about we don't have the information, you need to visualize, you need dashboards. Before you even get to that stage, you need the kind of technical infrastructure that allows you to hone in on the information that's actually going to be relevant to visualize. And so we need to actually, work on that aspect And I think in COVID, one of the key challenges was not just, okay, in one hospital, do we have a view on what's happening on the ground, but we needed that information connected across the entire healthcare system. And we needed to know not just what was happening in New South Wales, but what was happening, you know, in every hospital in Victoria. And obviously, you know, we were lucky to some extent in terms of how we fared with COVID, but internationally, these issues of aggregating information and connecting information in order to answer questions about how you know, what are the outcomes, how do we manage particular patients, what are the risk factors that we need to be looking out for, you know, who can we ask to stay at home comfortably and just, you know, weather the illness, but who needs to be in the ICU. Those kinds of decisions really need to be based on evidence, which comes from data, which then needs to be accessible.
And so what is the challenge with getting these databases together? Why can't we do it? We've got the information, presumably, it's sitting in databases all around the world. Why is it not being collected together?
Well, there's a number of different answers to that question, starting with normalization standardization. So one key problem is that the data just isn't represented in the same way. So it's collected in different ways, and you know, things are captured differently in different sources. And just comparing data from different hospitals can be very challenging because of that. Then there's also a real concern with privacy. And so one of the key factors that impedes data sharing is just the concern that we have to take care of the patient's privacy, that, you know, we need to be respectful, you know, arguably you need consent for sharing the data. And so if we don't actually have mechanisms in place for asking patients if they're comfortable with their data being shared and actually understanding under what conditions they're comfortable with that, then we don't even have, you know, essentially the right to start sharing data. And it happened anyway. So, you know, so people, you know, felt the urgency to share data, and it is very important. And so they did it, you know, they de-identified to the best that they could, and they, you know, they took steps to protect the patient privacy. But fundamentally, it's not part of our system right now to actually think about collecting the data. To your point, you were saying, oh, why collect the data if you don't know what you're going to do with it? We're collecting data, and we actually haven't thought through the process for doing something with it, at least not to the degree that was needed during COVID.
And Anthony, I'll go to you now. You also participated in the last session, but do just introduce yourself again in case there's some new people who've joined us. But I'd love to hear a little bit about the new technologies that you're seeing coming through and the way that they perhaps are having an impact on healthcare. And you might also want to respond to some of the things that other people have said.
Yeah, absolutely. So Anthony Agoni, Chief Data Officer at Bupa. I'll respond quickly to something Karen said. One is getting access to data is one thing. The second thing is what will we do with that data? And typically the pathway is I have this idea and I'm going to try to solve or answer the question that comes from that idea. The real gap, the real opportunity, not the real, but an opportunity, a gap, is, you know, a lot of science, a lot of Nobel Prize winning science wasn't, I have this hypothesis and I'm going to test it. It's, oh wow, I wasn't expecting that. And we have copious amounts of data, and if we can get access to it, if we can standardize it, if we can make it available and put it in the hands of well-meaning but highly capable analysts, we all immediately give our research community the opportunity to see what are the hypotheses that we never thought about. Right at the moment, we are very limited to the big brains in the research community who are not guessing, but they have clear kind of thoughts on what they should be testing. But there's a whole bunch of serendipity in the data that we just don't see. And so getting that data and making it available to that community to say, hey, this is definitely not research. We need to respect the role of research and the scientific process. But here are some leads. Did you ever think about this thing over here? So I think that's a missed opportunity. In terms of your question around new technology, I think where we're going, excuse me, it's not so much new technology, but applications of well understood technology today.
Yes.
to problems that we hadn't imagined. And what I see is a real opportunity where we can, there's an imbalance, I think, between who is at the centre of health and or sickness. And right now, I think the balance is too much weighted towards the healthcare practitioner. So whenever you're sick, you have to call the specialist, make an appointment, fit in with their schedule. Hopefully it's not too late. As we digitise and telehealth and commoditise a whole bunch of tasks that are highly, highly repeatable without too much risk, I see the opportunity of putting the patient into the centre of the healthcare experience. And I think that's really exciting because you never think about being the centre of attention as much as when you're really sick. So the comfort levels that will come with, I've got this illness, I've got this condition, and I can get access to specialism, I can get access to diagnosis, I can be put on a track very quickly, I think is an exciting part of health. And we'll get to a world where we spoke earlier around it'll be more about prevention rather than treatment. And I think that's enormously exciting.
And I think just a general question for anyone on the panel, but obviously we've had a very unusual year and COVID has done things for the funding of healthcare, but for healthcare more generally, that have both been amazing opportunities, but perhaps also lost opportunities. So I guess I'm opening it to the panel to just consider, is there something that you've seen that you think has really advanced the cause of healthcare through analytics in this unusual COVID year? Anything that you think could have happened and we lost the opportunity for it? So that's just a very open question there for the panel.
I would say things that could have happened. Obviously, we've gone through a process of identifying where you've been, logging into cafes, etc. That comes with enormous privacy issues that we need to get over. In a future world where people are more willing to give up information for the good of something, and not for commercial gain, but for the good of society, for the good of the health of the nation, I don't think we've missed an opportunity. I think what we've got at the moment is we've had a really good pilot test. Yeah, really solid proof of concept. What the missed opportunity would be is if and when this happens again, we haven't learned from this proof of concept today. So who is in charge of doing the PIR at the end of COVID to say, right, this worked well, this didn't work well, what could we do better? So that for me, I'm hoping that there is some group out there who is going to do the retro on the COVID data experience.
Yeah, because I guess Kudzai, as the most qualified medical professional here, I guess it's fair to say we should expect another pandemic. And I guess the question is, how can we, particularly from the analytics community, make sure that we've done everything we can to learn and to incorporate the best possible responses for the next time this comes around?
Yeah, a lot of it, and I think the thing that probably connects all of our different perspectives is around the infrastructure. Yeah. So we clearly had inadequate infrastructure. That, from my perspective, it's things like the internet in this country. Man.
But we've got the NBN. What I don't understand.
It's things like that make it possible to either do really wide-scale data warehousing or just give up. Just say it's not possible, we'll have to come up with something in the moment, and coming up with things in the moment is impossible. So it comes down to infrastructure and what people are prepared to invest now that we've seen how ugly things can get, and there's no reason it won't happen again right now. There's no reason it won't happen again in 5 years, 10 years from now. So what are the sorts of infrastructure investments and how are we going to evaluate them to make sure that they're sort of evolving in the right way? Because you can't always make it perfect, but how will you actually test before the event then happens? So, for you working in your sector, what's the sort of infrastructure that you'd like to see? And more than that, I think one of the biggest challenges that I saw was that nexus between state, federal and local government and that mess. So I went to Sydney a couple of weeks ago And their check-in system is pretty much the same one everywhere you go. That's a really, that's a lovely experience. Yeah.
It's wonderful.
It's a lovely experience, but why is it that there are some states that aren't there? So it's really having a look at what happened, what went really well, and saying this needs to be the new standard. And then everyone's got the same piece of infrastructure, because if it works in New South Wales, there's no reason it shouldn't work in other places. And just get over, I guess, that unnecessary friction and tension between the layers of government that I think really frustrate. Just saying, that was awesome, guys, let's take it and let's make it work for everyone else, because we're one country that sometimes feel like it operates like fiefdoms, frustrating little fiefdoms. And I think, yeah.
And I think that applies, the issue of jurisdictional boundaries applies right across the system. So it's not just, state versus federal, but it's also GP networks versus hospitals. How are they communicating and sharing and working together? Because clearly, we need to have infrastructure to support communication across those jurisdictions as well. And right now, they're not very well connected.
Mm. Two things for me. One is sort of specifically health related, but one is more sort of community related, and that is, I think we need to put in place more surveillance type, not surveillance as in Big Brother looking down on you, but surveillance of health things. Like one of our previous clients, they did after hours home doctors visits. They were like the perfect, almost like random sampling tool of, parent rings up, sick child in the middle of the night, doesn't want to take to emergency, doesn't want to take to doctor. Doctor comes and says, your child's got the flu, or some sort of transmissible gastrovirus or something. They could report that information, even just aggregate. Hey, we've noticed that the background level of gastro in Melbourne is X cases per 1,000 people. We've noticed that it's gone up in this area to 5, not 2. Should there be something we could concerned about? Norovirus is in the preschools in the local area or something, or respiratory problems or whatever, and go, is that something we should care about? And then maybe it's not, but maybe it is. And the other thing I've noticed is this has shone a very bright light on our general lack of data literacy in our community. Now, we're hearing at the moment, oh my God, some people have got blood clots when they've got the vaccine in Europe. Oh, stop it. No, it's actually probably lower than the background level of blood clots in the community anyway. So I think there's an opportunity for us to teach everybody, however we start it, to be more, when we hear data things, how can we critically think about that, and what does that, not look at the absolute number, but, well, is that a number I should care about? And at least be able to ask the questions to use data, and that's important for business, health professionals, but just the general community as well.
Now, we have some great questions that are coming in from people who've been watching, and I'll put these to the panel, and hopefully we'll have a bit of discussion. The first is actually going back to a very early part of our panel discussion, which was around ICU capacity. Why were the forecasts so far off the mark? Were they far off the mark, or did we just get lucky with COVID here?
So the initial modelling, I think they did in about April last year, and that was sort of federal number crunching to see how bad things could get, and that was really modelled on uncontrolled spread. So I think wherever you look, you'll see that and I think there were little sort of caveats there saying, remember, this is a forecast, we can't actually predict the future, which is, that's a data literacy thing. Like you say, look, modelling is what it is. It's what you put in, what you exclude, that will give you a prediction of what may or may not happen. So I think, 35,000 cases or ICU patients per day is perfectly plausible within the range of, well, if it happened in aged care, you're in strife, you're in real trouble with people who are very, very sick and, sliding towards death. So I don't think you can ever say that it was wrong. I think it's more a question of, how accurate. It's a question of how accurate was it, not it was definitely wrong or right, because you don't want to test it. You want to say, okay, let's let it rip and let's see if it really was 35,000 or if it was 40 or 50.
And the modeling allows you to kind of do a counterfactual reasoning sort of thing, like, well, if we don't do anything to control it, yes, and that can then give you an incentive to go back and say, okay, now let's model if we put in place social distancing measures, if we put in place a lockdown, and
the letting it rip's not going to work. What should we do then?
I must say, I was personally stunned by how accurate the modelling was in Victoria around when the lockdown was likely to end. It was extraordinarily close, which gave me quite a lot of comfort that probably the assumptions going into the model were not far off, actually. So I thought that was interesting. There's also a great question. It's actually come in for you, Kudzo, but I think there's more people on the panel who would probably be interested in it too. And that is, can you envisage the evolution of data-driven medical care more into the predictive sense? And how would you balance that with the unintended ethical concerns? Now, I know, Karen, you've been doing a bit of work on this specifically, so I might actually go to you, but obviously others, do feel free to chip in as well.
Yeah, this actually came up in our previous conversation when we were preparing for the panel, exactly this. So I have a student who's working on something you alluded to, which is sort of early prediction of the load in the hospital. So based on what's happening on the ground within sort of 12 hours or 24 hours of a patient's admission, can you predict how many resources that patient's going to require? Essentially, kind of weighting the amount of time they'll be in the hospital, whether they're going to require surgery, these sorts of things. And we've had this discussion that in principle, what we're trying to achieve is essentially better management of resources to allow hospitals to plan, for what's coming in the next hours or days. But you could also use it to decide to not treat a patient that you think has a very high risk of mortality, regardless of what heroic measures you might take. And this, of course, raises a very serious ethical question around, how do we use these predictive models? And, we've kind of settled on, well, we're looking at this in aggregate. So it's across, all of the patients that are in the hospital at a given moment. It's not meant to be used for making decisions at the individual level. But it could be used in that way. And so we have to just be aware that those issues exist and think through, what are we trying to achieve with these models.
And of course, this is a common issue with analytics in general. The more information you have, the more you know for good and for evil. Yeah. And there's a huge amount about how you use that data correctly.
And there's also, I'll talk about the data collection. I might land on to talk about the medical pathways. But there's also technology which, as disturbing as it sounds, commoditizing the collection of biological data in the bathroom, the things that you put in the toilet often get used for diagnosis. If we can find a way to commoditize blood reading in the bathroom or probably some other hygienic place, there's ongoing work that says we might be able to predict stuff in individuals from a long way out and have a real opportunity at doing preventive measures rather than curing. So if we could get our hands on that data sooner and more regularly, there's an enormous opportunity there, isn't there?
And it sounds, Anthony, like some of those applications leave the data at the individual level, which then gives individuals a bit more chance to choose how that's shared. And of course, that's a movement that's happening in a lot of different places with data privacy. We have
just one quick one. I think we need to be mindful of sometimes the hubris that analysts have, as in, well, if I've got a lot of data, therefore I know a lot of things. And I know particularly when my father was getting older and he had a lot of complications, the doctors were saying, look, I know we know a lot, but there's actually a lot we don't know. So just because you've got data doesn't necessarily mean you understand the linkages between, well, this bit of data and this bit of data, and this is going to cause this sort of outcome. So I think there's that sort of, calm we need to bring into the analyst to say, well, I know because I got data. Well, this suggests, and sort of that changing that mindset.
So I would challenge that with the reason why we don't know these things is because we don't have data at scale. We don't have it connected. And so in a new world where we're hopefully overcoming those barriers while still having a very clear focus on privacy and ethics, there's a lot of stuff that we don't know, but I'm certain a lot of what we don't know is in the data. We just haven't thought to ask the data the question.
Yeah, and I think rare diseases is the sort of ultimate place where you see that, because a disease that's rare at a local level is not really that rare, generally speaking, when you think nationally or internationally. And if we can start to ask questions of the data around, what are the trajectories for patients with these sort of combinations of symptoms or diseases, then we're better placed to actually help manage those diseases.
And Karen, that segues beautifully into another question that was asked about standards for data capture. Are there international standards that allow us to accurately compare or use data in the health area?
Yeah, there are, and we're very, very privileged actually in the health sector, because there have been international efforts to standardize the vocabulary essentially of medicine. So, we use these constantly for modeling. International classification of diseases is sort of the one that's probably most well known. But in addition to that, we have vocabulary such as SNOMED, which capture clinical terminology, symptomology at a more fine-grained level. We have standards for capturing drug names. We have standards for capturing the ingredients of pharmaceuticals. There's all sorts of standards. And in fact, the National Library of Medicine in the United States has been managing these resources for the global community for decades, really. And so that's a starting point. But, there's one thing to have those terminologies and the coding systems for representing the data, and there's another thing to actually use it. And so there's now increasing international efforts to actually standardize on using these codes, because the electronic health record systems, or indeed the sort of older electronic data capture systems, often just had ad hoc field names and weren't using the coding systems even though they were available. So there are efforts such as Odyssey, which is the Observational Health Sciences Data Initiative, which is an international collaboration to basically describe data, capture data in different sources using a common data model. And that then opens up huge opportunities for comparing, contrasting, doing analytics in a way that starts with that kind of normalized, grounded data using the same language.
And we actually have a wealth of questions coming in. Thank you so much to everyone. Another is, given the most recent Royal Commission, one of the recommendations was e-charts and the preferred option was Medimap. What other alternative softwares exist in the current market? I'm just going to put that out there. You may or may not know if there's no one.
I mean, I go in the aged care sector. There are lots of your sort of e-health records that have a medications function incorporated into it, and some of them don't. But in terms of just pure standalone e-med solutions, I wouldn't have a good visibility of everything that's out there. But I think when those kind of choices are made, I think what people want to hear or want to really clearly understand is what was the rationale for that particular solution being chosen as the one, and how far afield did people look. Because I think there's often a tendency for decisions to be made by a small group of people who kind of go, yeah, this will do. We can do this quickly, as opposed to this is genuinely the best solution. Factoring in things like the digital literacy of the staff within aged care as well. We go, this is a great solution, go dump it in there and have people go, oh my goodness, this is terrible. That we really need to be judicious and create those spaces for people who are actually going to be the end users to go, no, or no, this is fantastic.
I would say that we don't actually need a one-size-fits-all solution. That there's room, indeed, So as long as there are ways to effectively share and compare data from different resources, it doesn't matter. It matters for the people who use the tools, but it doesn't, from a kind of analytics perspective, it doesn't really matter.
Just building on the two of you, like, what's the most suitable tool in aged care may not be the most suitable tool in a general hospital. But as long as the data is interoperable, so when Mrs. Smith comes into the hospital, her data comes completely and accurately into the hospital system. That's the important thing.
And again, speaking about end users and making sure that we have usage that's well informed as well. Interesting question here from Leanne saying, if people are to become the true centre of healthcare, how do we prepare people to become the stewards of their own data in their own interests? So how do we actually help to raise, I suppose, both awareness and literacy of individuals to be able to use data, their own data, in their own best interests?
There are a lot of efforts now to do co-design with consumers, right, with patients. And so I think that's really part of the answer there is, what do people want to know about their health? And obviously in the consumer space, we see a lot of new apps that are coming out. You've got Apple Health, and you've got all sorts of things, Fitbit and what have you. And that's all part of people starting to kind of take an interest in what's going on with my body, what's going on with my health, tracking their weight, their menstrual cycles, whatever it is. And increasingly, you can track your blood oxygen levels and heart rate and things that are, essentially very fine-grained data. And I think engaging people into, well, what do you want to know? What do you want to use this information for? And, how can we share it with your medical providers? Because we're clearly not expecting every individual to become a medical expert on themselves, but they are an expert on what's going on with their body. And so if we can facilitate ways to kind of collect that data and share it, then it becomes, input to a conversation with somebody who can then help to interpret that data.
And I think in the pre-session, we were talking about language translation, so various spoken languages, but also we spoke about professional language translation to lay translation. So having a standard that says, well, this long Latin-based medical term means this term to the layperson. So when they're using an app, they're reading something and they know the average consumer sees it, the medical professional sees it and knows what the translation is. But I think this gets back to what I said earlier about we really need to talk about data literacy in our community and start it at school. So when people, oh no, my blood oxygen level's low. Yeah, that's just one spike because you held your breath for 5 minutes. You're otherwise okay, and making people aware of how to understand data and what it means or doesn't mean or could mean or can't mean before we start throwing all these tools on people, because it's going to freak everybody out if we're not careful.
Well, we're at the end of our time, just about. We've got one more minute, and unfortunately, we've got lots of great questions we didn't get to actually reach. But I'll just allow for maybe a 30-second wrap-up. What's the one thing you'd like people to take away when they're thinking about analytics and its use in healthcare? So I'll start with you, Anthony.
I think I would love for people to weigh up the utility of giving up their data and all the possibilities that can come out of it, both at an aggregate level and at individual level. We need to fight the good fight around what are all the good news stories. We're not very good as an analytics community around promoting what we do and what we can do, and we let the bad news stories take the lead, and we need to report the bad news stories, by the way. So we need to promote, and we need to have people thinking about the art of the possible. What could happen if I gave up my data? What's all the good that could come out for me? And we really need to have a balanced dialogue.
Yeah, thanks. Kudzo, yours.
I think I'll bounce off Leanne's question around preparing people to take ownership. I really strongly encourage all of my patients, clients, whatever the best term is, to really be proactive in asking for their information. So often once you've left a clinic room, it's very hard for you to get that information. So I'm always advocating for, if you've had a test done, once you get the reports and own them, because that belongs to you, and people cannot deny you when you're in the room with them giving you a copy, and get it at the time of the consultation, because that is the first step for you actually starting to see the full picture of your health. And that includes hospital records as well, because I think still that power dynamic is still weighted towards people feeling a little bit anxious or afraid to ask. But it's your right to ask, and you should own that information in whatever format that you feel you can handle or comprehend, and also advocate for people within your family or your circle who sometimes get denied information, because at the end of the day, it's yours.
Thank you.
I was going to say exactly what Anthony just said. And so I might just sort of build on that and say that, we should be asking why we're not getting more value out of the data that we are collecting. And with COVID, I think people started to say, well, why don't we know this? Why can't we predict this? Why can't we estimate that? Well, because we fundamentally haven't set up a system that allows us to do that. And so I think that's really, imagine the art of the possible, but then push for achieving that.
Great.
And this, for me, I suppose my one goes out to the people in the analytics community. Don't get so hung up on what is the most complex solution I can build, particularly with my background in sort of operational analytics. You can learn a lot and create a lot of business value by using simple analytics that the business can understand, the business can work with, and then that's the stepping stone for you then to bring them along with the journey with you to the more complex. So it can be fast and effective, but also help your journey.
Well, thank you so much, and I'm sure everyone watching will join me in thanking the panellists for a really interesting and far-ranging session. There'll be a short break now, and we'll be back at 11:30, so we'll see you then. Thank you.
Thank you. Great.
In an uncertain world, understanding data is more important than ever. It can help organisations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organisations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organisations to put their future into their hands.
At SAS, we love bold questions, outrageous and impossible questions. The answers are waiting to be discovered because space isn't the new frontier. Data is. And with the right questions and the right analytics, we make data do amazing things. Like make the world safer, faster, healthier, and kinder. All we have to do is ask the data, analyze it, shape it, and make it work smarter for everyone, everywhere. With SAS, you can turn data into answers and ask the questions that move the world forward. SAS, curiosity forever.
AI in the enterprise is all the rage. But put the hype aside. How are today's organizations actually executing and seeing value from enterprise AI? Dataiku is the platform, democratizing access to data and enabling companies to build their own path to enterprise AI. To make enterprise AI a reality, Dataiku provides one simple user interface for data preparation, data exploration, automated machine learning, model deployment, AI monitoring, and management. Dataiku is built for everyone with robust features for both the code-free and the code-first. From business users and analysts to data scientists and engineers, Dataiku makes working with data faster and smarter. Each company's path to enterprise AI looks different, so Dataiku supports the creation of a spectrum of applications. Whether that means building out a self-serve analytics platform or fully operationalized AI integrated with business processes. No matter what the underlying changes in architecture or advancements in technology, Dataiku remains at the center, the cornerstone of data governance and responsible AI. Dataaiku's centralized, controlled, and elastic environment fuels exponential growth in the amount of data, the number of AI projects, and the number of people contributing to such projects. Dataiku, for every industry, every use case, and also for everyone. Discover your path to enterprise AI at dataiku.com.
People have got a unique thing about them, which is not only are they awesome technically, but they feel a sense of belonging. We genuinely call ourselves a family. Genic was started out of a desire to start something from scratch that tried to tackle the data market with a new and fresh approach.
Our vision is to never settle on a technology, to be constantly chasing the unicorn.
The space is moving really quickly, and we see it as our job to be aware of new things coming, and when they are good things, be able to introduce them to our clients.
Databricks is the data and AI company. We help data teams solve the world's toughest problems. They can't be solved in silos. They can't be solved by one person. We need all the data, all the science, all the brain power in one place on the only open, unified platform for data management, business analytics, and machine learning.
In an uncertain world, understanding data is more important than ever. It can help organizations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organizations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organizations to put their future into their hands.
At SAS, we love bold questions, outrageous and impossible questions. The answers are waiting to be discovered because space isn't the new frontier. Data is. And with the right questions and the right analytics, we make data do amazing things. Like make the world safer, faster, healthier, and kinder. All we have to do is ask the data, analyze it, shape it, and make it work smarter for everyone, everywhere. With SAS, you can turn data into answers and ask the questions that move the world forward. SAS, curiosity forever.
AI in the enterprise is all the rage. But put the hype aside. How are today's organizations actually executing and seeing value from enterprise AI? Dataiku is the platform, democratizing access to data and enabling companies to build their own path to enterprise AI. To make enterprise AI a reality, Dataiku provides one simple user interface for data preparation, data exploration, automated machine learning, model deployment, AI monitoring, and management. Dataiku is built for everyone with robust features for both the code-free and the code-first. From business users and analysts to data scientists and engineers, Dataiku makes working with data faster and smarter. Each company's path to enterprise AI looks different, so Dataiku supports the creation of a spectrum of applications. Whether that means building out a self-serve analytics platform or fully operationalized AI integrated with business processes. No matter what the underlying changes in architecture or advancements in technology, Dataiku remains at the center, the cornerstone of data governance and responsible AI. Dataiku's centralized, controlled, and elastic environment fuels exponential growth in the amount of data, the number of AI projects, and the number of people contributing to such projects. Dataiku, for every industry, every use case, and also for everyone. Discover your path to enterprise AI at dataiku.com.
People have got a unique thing about them, which is not only are they awesome technically, but they feel a sense of belonging. We genuinely call ourselves a family. Genic was started out of a desire to start something from scratch that tried to tackle the data market with a new and fresh approach.
Our vision is to never settle on a technology, to be constantly chasing the unicorn.
The space is moving really quickly, and we see it as our job to be aware of new things coming, and when they are good things, be able to introduce them to our clients.
Databricks is the data and AI company. We help data teams solve the world's toughest problems. They can't be solved in silos. They can't be solved by one person. We need all the data, all the science, all the brain power in one place on the only open, unified platform for data management, business analytics, and machine learning.
In an uncertain world, understanding data is more important than ever. It can help organizations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organizations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organizations to put their future into their hands.
So welcome up, everybody. That was a couple of fabulous sessions, as you surely agree with me. Now we're coming up to the third session, which is going to be equally fabulous. To start the session, I'd like to introduce Mark Alexander, who is the Managing Director of Agenic, a consulting company in the data space. Mark is also a qualified health professional. He's a physiotherapist, and if you've read his bio, but if you haven't, let me just highlight a couple of things. Mark, as a physiotherapist, was the physio for the triathlon team of our country to 3 Olympic Games. That's quite extraordinary. He then went on to do an MBA from Melbourne Business School, being the Dux of Class, which is equally extraordinary, because it's hard to be Dux of Class here. Mark has then gone on and worked for BCG. He's worked for Medibank and also for Microsoft as a marketing advisor. But Mark and I know each other really, really well. And I say this because Mark was the first executive director of the Centre for Business Analytics. I met Mark a few years ago, and it was very clear that when we started our Centre for Business Analytics, we needed somebody entrepreneurial to be able to take us to where we would like to be in the first 3 years of the center. And Mark was the perfect person for that. He was terrific in terms of his vision and his ability to get things done. And he loves to talk about that particular aspect, but he also actually delivers on it extraordinarily well. This conference that you're in was his baby. He thought about it. The Datathon was his baby, and we are now taking it to new levels, but we could not have done it without what Mark set up in the first instance. I can vividly recall when Mark proposed some ideas around the conference and the Datathon. I said, well, no, let's do this, let's do that. Thank goodness we didn't actually listen to me, that we did what Mark wanted us to do. And that is why we are as big as we are today. So thank you, Mark, for that. And thank you for leading this session for us, which is absolutely going to be extraordinary. So welcome, Mark, and over to you.
Thanks, Ujwal. Just checking that the listeners can hear me. I will assume that's a yes. Great. Can I just, the conference organiser, on the notes, I'm getting previous notes, not the notes from my current presentation. So hopefully you'll be able to fix that up for us. But thanks as well for that fantastic introduction. We are having some slight technical difficulties this morning. Phil is having some audio issues in hearing us present, and he's still trying to log back on. But I can in that time I can do a introduction of Phil, which I was going to do anyway. And so Phil is not just a surgeon. He's a unique individual, that he's a specialist surgeon. He is an academic and researcher. He is an administrator, as well as he's a software developer and has significant technology and data experience. So he completed his specialisation in colorectal surgery. He's got public appointments at Austin and Eastern, private appointments at Epworth. He's completed innovative robotic surgery training at the Cleveland Clinic. Academic and researcher, so he's completed a Doctor of Medical Science at the Uni Melbourne, clinical degree, clinical research methods degree, I should say, from Monash Uni, and a senior lecturer at Uni Melbourne in surgery. He's an administrator, and that's what we'll be talking to today, and that he chairs the operations committee for the Binational Colorectal Cancer Audit, the BCCA, which we'll talk to in much more detail. But he's also a software developer. He founded an app over 10 years ago that's one of the most popular medical apps used specifically by doctors and surgeons, called MBS Search. It's used over 1 million times a year, and that enables surgeons to basically search for their relevant MBS codes for their consultations and surgeries. So that is, it highlights the skill set that Phil brings. And the agenda today, we are going to cover the problem. Phil's going to cover that. Hopefully we've got the audio-visual issues sorted out by then. He's going to cover the old solution that BCCA utilised, and then we'll both cover the new solution. So I'm just checking that we still have some audio-visual issues with Phil. So I'm seeing that from our organisers. So I'm just going to quickly check the message that Phil is basically restarting and logging in again. So I guess I'll have to kick off in Phil's absence, but hopefully Phil will be able to join us. He's sorting out his audio-visual issues. So bowel cancer is the second most common cancer of all cancers, and we'll have a graph on that in a second, and the second most deadly. It can be found in patients with no symptoms. So it's a unique cancer like that Phil will talk to later. And it can be found in its earliest stages. So that means bowel cancer is one of the most curable cancers, unlike other forms of cancer, which are detected very late and at very low survival rate. Phil is obviously best to talk to this, but the reason bowel cancer is quite unique is there's a very long precancerous phase. So that's a picture of our bowel, normal on the left, carcinoma, and obviously very late stage cancer, and mortality rates on the right. Cancer progresses along a number of stages, and that's why with screening and polyps, etc., over 5 to 10 years, that's why screening is very important in bowel cancer, because it is one of those rare cancers that can actually be detected and then actually treated. And Phil will talk to some very good surgical results. So moving to the next slide. You can see the data here that bowel cancer from an incidence perspective is second in both men and women, with prostate and bowel being number one. It's the second most deadly in total, lung for both men and women, prostate second for men, breast second for women, but in total, bowel cancer is the second most deadly cancer. And it's not just young people. The bowel cancer is rising in our under 50s age group, and so it's not just for us young people. That we think about this as an old person's cancer. It is happening in our younger patients, and this is a patient, Nicole Cooper. It's all publicly available, very high-profile media person. She was diagnosed in her early 30s with a young child, and it just shows you the face of bowel cancer is not just something for the mature individuals. A simple bowel test can save you, and this is a program that has been going since over the last 20 years or so, has been rolled out, but now it's available for 50 to 74-year-olds. It's a free test. You basically take a stool sample, they test for blood. It's not sexy, it costs $75 million a year, 42% participation rate. So that's relatively low, but it is a very important screening test. And sorry, I'm just checking. You need to push to audience here. Okay, my apologies there for talking away without the slides. So are we having significant issues here today? The graph there, and you can see that. Nicole Cooper, as I mentioned, and our screening test, so we're up to date now. The screening, there's minimal auditing of the treatment outcomes. AIHW does a fantastic job of summarising the effects of screening, but there's minimal link and auditing to the treatment outcomes after the screening, and this is important to note. So basically, the surgeons and the clinicians don't know the impact of screening and the surgical results. There's a lot they don't know. And Phil, we'll come back to these slides, hopefully when Phil can get on. But again, from a surgical outcomes perspective, he's got a $3 million robot that he uses to operate, pulling out cancerous sections of bowels without making large incisions. There's a hypothesis that there's better outcomes, but there's actually no systematic reporting on that. So again, they don't know. The binational colorectal cancer audit, which was our client, and hopefully Phil can get back on. The other factor I should say here is you would have seen potentially at the start when Phil was on and no audio, but he is a surgeon. He is actually at hospital today. I'm hoping he hasn't been called out to an emergency case, but that is something we may need to keep in mind. This was founded, this audit, which is a surgical registry, was founded in 2007. There's around 450 surgeons, very low budget. It's voluntary data entry, and they're capturing around 29% of the colorectal surgery cases in the country. There's over 41,000 cases in their database, and they're reporting on demographics of the patient, if they screened or not, the details of the tumour, what surgery they had, and complications, etc., so that that they can actually audit and analyse their data effectively. They do produce an annual report. It's not real time, it's a paper-based report. There's obviously no interaction there, and it's a legacy method. So, but there are some very good results that come from that. And you can see the orange bar is the data from the stage of tumours that are captured from patients that are screened, and the green bar is the non-screened patients. So we see that the screened patients capture cancer at earlier stages in stage 1, and that research shows that clearly has better outcomes for the patients, reduced length of stay and complications, etc. So screening is very important, and I'm hoping that seeing movement at the station, whether Phil's coming back on there. So let's see if he's in shortly. And this has been published in the Medical Journal of Australia. Phil and his high-profile interview with Norman Swan on the ABC, and we, summarising the problem. I mean, Australia's economy is very large. 10% of that spent on health. Bowel cancer is the second most deadliest cancer in total. It's the 6th highest cause of death of all causes of death, and the deaths can be preventable by early detection and treatment. So they're spending $75 million on screening. They're only spending $150,000 on basically auditing the clinical outcomes of screening and treatment. So, Phil, I'm just checking whether you're there or not yet.
I can hear you, but I can't see the slide. Sorry.
Okay, so Phil, we can hear you. So we're now on the goals slide, but do you want to quickly summarise? I mean, I've talked through all slides through to the goals, but just, I guess, from the clinician's perspective, the importance of how big the problem is and the importance of screening and, the data and analysis for this problem.
Yeah, I guess what we're trying to generally highlight is that for such a common disease with a very accessible pathway for early diagnosis and treatment that has a very appropriate large spend on screening, what we're missing in the granular detail that we need and also in the time that we need it is the clinical outcomes so that we can feed back into our surgical databases and produce meaningful change to the way that bowel cancer is delivered.
Yeah, great. So we're on Phil, we're on the goals slide now, just around increasing participation rates and surgical outcomes.
Yeah.
And so now I'm on the old solution slide, Phil. The BCCA.
So we had in our database we had a lot of technical debt. We had a SQL Server and a .NET implementation that was many years old and hasn't really been updated. It doesn't provide meaningful information in a way that a clinician can read and analyse in real time. So, part of our problem is that we really needed to go and improve the visibility of these data sets so that we can feed back to hospitals, clinicians and government about what our outcomes are and where we need to improve.
Thanks, Phil. And next slide, your app.
So my background, I have some expertise in software development, obviously not as an enterprise level, but I know that really in this particular space you need a unique expertise to produce this. You need someone with very good UI UX expertise. You need health background because no one understands the subtleties of health unless you're in that space. But also you need experience in administrative and government data sets and blending that sometimes delicate interface between all those elements. So good UI, health background, and expertise in these bigger projects is what we're looking for. So I'll allow Mark to talk about the role of the GINIC in producing that solution for us.
Thanks, Phil. I mean, as Ujwal's introduced us, so we don't need to labour this point, but we do help our clients, solve complex problems, and the vision of Centre for Business Analytics is shared by us around transforming decision making. But we do it a bit differently, incorporating design thinking, business strategy, and agile delivery with our experts in analytics and data science. With our deep industry expertise, people have healthcare professionals in the company that help our clients basically improve their decision making. So onto the project, we had a 4-week proof of concept. You can see our methodology there around forming hypotheses, using the design workshops, then getting to the point where we're using our advanced analytics expertise to test the hypotheses, visualize and iterate on that, so that Phil and his colleagues were basically getting the outcomes that they wanted. The analytics we did at clinician, health service and national level. And we, the first slide, this is purely descriptive analytics around surgical volumes plotted against the years since graduation. And that's important because of the link between, and I'll let Phil talk to that link.
Yeah, I mean, this is a sort of prototype of the space that we wanted to be in, which is taking publicly available data sets, which is date of medical registration, and then linking it to volume of surgery in our database. And there's certainly lots of precedent for the idea that volume and outcome are linked, particularly in procedural medicine. And this is just an example of what we wanted to show in real time to each individual surgeon. This is for their own eyes only, and it shows them where they sit amongst their peer group. It's partly to encourage youth, it's partly to discourage surgeons who might do 1 or 2 operations a year where we know the outcome, particularly in rectal cancer, is not as good.
And we should say at the outset that analysis was done on de-identified data. This is purely a prototype, so the blue dot is actually Phil, but this is publicly available on the bowel cancer audit website, and each dot represents a surgeon. And the next slide we can see, this is by surgeon, and we're looking at inpatient mortality, again plotted against the volumes. Now this is, it's important to note that to standardise surgeons here, we needed to do a risk adjustment. So this was developed by the Bowel Cancer Audit Organisation as well as Monash Uni, and we can see that these 95% confidence intervals, we can see negative outliers in red and positive outliers in green. And that risk adjustment basically standardises so that surgeons aren't penalised, that the surgeons that are basically doing more complex cases and such as elderly patients, more comorbidities, tumours in later stages. So this basically standardises each surgeon's performance. So Phil?
Yeah, so this I can now see the slides, which is good. So this data is really important. It's not that there is not some complicated outcomes here, but what we wanted to do is highlight, and the report has done this for some time, but we want to do it in real time so that those centres that are outside our confidence intervals for this performance can be looked at. The data is fed back to them in a de-identified manner, and then what we would use this as an exploratory thing to work out, okay, who are the high performers in terms of volume and outcome, and who are the underperformers and what's going on. So it's not meant to be as binary as perhaps this graph suggests, but it's certainly very exciting data to see, particularly when we can see it in real time, and you can see it within your own clinical practice and also within your own hospital.
And the next slide, we can, that one was mortality. This slide is very similar analysis on surgical complications, but we can actually go to the health service level. So this is actually hospitals, and each dot represents a hospital. So very similar analysis highlighting the positive and negative outliers.
Yeah, and this is really important because I think the way healthcare is delivered now we know you can take the same clinician and move them across health services and get very different outcomes. So surgical performance is very important, but also healthcare performance is vitally important amongst the individual services. And one example is that you can have the same complication rate, but one health service will pick it up more quickly, then generally their outcome is going to be better. So we, again, feed this data back to our participating centres, and it is risk adjusted, but that model gets looked at and changed every year. And this is really important, not only at the hospital level, but at a government level where healthcare planning can be designed and assessed about which sites are going to undertake which clinical activity.
Thanks, Bill. So our vision here, I mean, this is a prototype on the BCCA website, and the surgeons and hospitals can click through each of those KPIs on the right. But the goal, and this is purely de-identified data, the goal is that each individual surgeon and hospital can log in and obviously see their data. The rest of the data will be anonymised, but they'll see where they sit in comparison with their peers. And that's obviously the vision for this project. Now on to, I guess, national level analysis. This is data from the AIHW on screening rates, and it's simply plotting the rates of screening in Australia, where the dark regions are the positive regions, where there's higher participation rates, and this is now mortality rates. It's the reverse. The darker regions, there's higher mortality, so that's less positive. But this analysis, what our vision is to link these data sets with the bowel cancer surgical outcome data sets, so that we can actually then, I guess, facilitate the conversation with the government and policy decision makers to be able to better target the screening of resources, and for clinicians and governments to transform their decision making. So, I mean, at Genic, where we fit into this, we've got decades of experience in health data and analytics. We have a public data service that we have on hand to basically link, pool and link the publicly available data and link that to our clients' data like BCCA, so that we're enabling them to generate deeper insights. So next steps, I'll let Phil talk to that, and then we can go to Q&A.
Yeah, so that previous slide for us is really exciting, because we know that administrative data sets can be very powerful, but they need to be overlaid with real clinical and clinically curated data sets that try and interpret what that meaning is, because you can't just take a huge administrative data set and publish it and not spend some time working out what it means. So this opportunity to include our clinical data with these administrative data sets is very exciting, because we can get some real change in that space. And I suppose the next challenge for us is firstly funding. It's a big task. Takes a lot of man hours to put all this together, and we would really like to bring those dashboards firstly to our surgeons, and then to our hospitals, and then for a more a broader consumption once they're refined. And not overall, I guess our aim is really, the purpose of this is if we can highlight, for example, the clinical impact of screening in saving lives and improving treatment outcomes, and we can close that loop, and also homogenise the standard of care across Australia, which is already very good, but we know it is variable. Then that's really the power of these data sets. So it's a very important task to execute.
Yeah, and I guess from our perspective, it's around bringing our healthcare expertise with BCCA and just productionising that analytics. So it's real-time analytics that a surgeon and a hospital can observe their position in relation to their peers in real time. So that advanced analytics algorithm, it's we can talk to that in Q&A potentially, but it's very important that they can actually see these results and then actually do something about it. Like Phil said, it is an algorithm, and therefore it's not about naming and shaming, but it's about, where do they sit in relation to their peers, and then being able to implement change. So thank you all for your time. We're going to go to Q&A now, which there have been some questions posted. The first question up there actually, before we go there, I'm going to ask Phil a question. We're both health professionals, and making a difference to people's lives is what we do. So, Phil, what advice can you give to all attendees on the basically preventing bowel cancer?
I mean, it's pretty easy. It's get screened. So you'll get a kit in the mail at age 50. You can do it from age 45, either through your GP or directly through the website. But it's all about screening. That's the summary.
Fantastic. Thanks, Phil. And I guess you've highlighted your your vision here. But what would you say if there's a patient and should they be able to see their own surgeon's performance or the hospital's performance? What are your thoughts on that controversial topic?
Yeah, I think that the clinicians involved in this definitely have an interest in the system. For their own practices, they want to improve and they want to see where they sit. They want to know what best practice is and how to implement it. I think there's a broader question. I think the UK have been, a few steps ahead in this space where they will publish individual unit clinician and in some clinical specialties, surgeon level data. It's a tricky area because, potentially you prevent clinicians from taking on some of the harder cases for fear of being exposed as a bad surgeon. And similarly with hospitals, you'd see that difficult patients are denied or refused. But in my own personal view is that patients are incredibly valuable partners in their own healthcare, and there's a lot of science that says that you involve patients in the decision making, the outcome, and where the areas of doubt are, and allow them to make their own choice, and the outcome is better. So my own view is that it should be transparent, but the devil is really in the detail about risk adjustment. Making sure that this data is verified and correct. So it has to be done in a very sort of staged process to make sure that it's gotten, it's correct. And it is a relatively fast-moving space as well. Treatments change, new drugs come out, so it definitely has to be curated by the clinicians. But I think patient involvement is a very big and important space. Movember and the prostate cancer group have probably been the best in recent times at going down this direction, and I think we hope to be there too.
Yeah, thanks, Phil. And a question from the audience around, I guess, the AIHW data, the two maps of Australia. They're talking about, is there a link potentially between high incidence rate and then driving a higher screening rate with a lag, obviously. So, I'll take this one and then Phil can comment. What we've done is obviously a very quick prototype and just surface the data and visualize that. And we would love, obviously, to get funding to then be able to link all of the publicly available data sets where you see in real time, we can get obviously the most recent data from AIHW and link it with the surgical outcome data from BCCA and actually see the timelines from, say, 2011 incidence to mortality years later to then screening rates, and actually start to do that analysis to see if we can detect those patterns. So, and then we can obviously link it with the surgical outcomes. So in all of those regions in Australia, our vision is that surgeons, the public, but surgeons and hospitals can actually log in and see how are they actually performing and what are the screening rates for that surgeon's patient cohort in that region, and what is the cancer incidence, and looking at those patterns over time. So great question. Any thoughts on that, Phil, to finish?
Yeah, I think administrative data sets are very, very powerful. I think if you look at those national maps, one of the real problems is how contemporary they are. I mean, it takes a long time to process and access, and we go through a very detailed ethics process, and there's issues about secure hosting environments and privacy and all that very appropriate stuff. But I think there is an enormous amount of power in that data, and particularly where it's blended appropriately and then it's surfaced in a way that's easily understood, because I think it contains very powerful messages. and getting that presentation, curation, and all the details correct is not a minor feat, but it does have the impact. I mean, you people do the maths on improving screening rates, and it is honestly thousands of lives to get people to screen. There is a science to get them to do that, and the screening registry are undertaking that work where they're targeting areas of underscreened patients. And what we can provide in a bowel cancer audit is really meaningful clinical data about what the outcome is for screened patients, and we know in those preliminary studies that it's better. So very, very powerful if done correctly.
Thanks, Phil. And I've just been told we can go for a couple more minutes based on the delays. So not a question, but a comment from someone. So thank you for the two of us for the work in this area. As someone who's had grandparents on both sides of the family pass away from bowel cancer, so thank you for that. And I have grandparents on one side that similarly had this similar outcome. So passionate in this area, as obviously Phil is. So one question from Preeti around the app that we showed of yours, Phil. What data does that show? Phil, would you like to talk to that?
I mean, the intention of that is really, I don't want to get too. The intention of that was to basically try and identify volume and geography. It's really the same task that this bowel cancer audit is doing. So all it does is it's a very simple kind of program that involves being able to use natural language to explore the Medicare schedule, which is 6,800 item numbers, which describe the clinic's activity that procedural or a consultation might involve. And this goes back to when iPhones first came out, and geolocation was really quite a interesting tool to use. So if you know where someone is, what they're doing, then you can get some idea about volume and performance. And if you think about now, how do you find a specialist in a particular area? Your aunt has a dodgy hip and you want to find a good hip surgeon, then often it's on reputation and these sort of non-scientific methods of, what does their website look like and where do they work and all that kind of thing. And what we want to, or what the intention of that project was really to surface in a scientific way, not a empiric way, about volume and outcomes. So if there's a hip surgeon in Sunshine who's doing far more volume than anyone else, then usually that's linked with someone who's doing a pretty good job at it. Because if they weren't, they wouldn't get those patients. That's generally the rule. So that was the intention of that program. It's sort of
good segue.
An initial.
Sorry, Phil, it's a good segue to another question. Yeah, it's a good segue to another question around from Christopher. Patient outcomes capture analysis is an issue, and brackets largely absent across many surgical disciplines. Should it be mandatory? Example, the orthopedic joint registry, which is hips and knees.
I think so. I mean, I think if you've got someone,
and this has to be quick, Phil, because this is our last question. Sorry.
Well, health in our country, 75% of it is Medicare funded. So, I think this is an active debate within the Colorectal Society with rectal cancer, for example. I know it's an active debate in esophageal cancer. I think that sort of thing is coming, and I think, really the payers of healthcare, that's both the patients themselves who fund part of the healthcare and also government and insurers, really probably should demand it. I mean, it has to be done with a clinical overlay. You need people in the field to know which questions are the right ones to ask. It's very easy to use the lies and statistics thing to get the wrong outcome. So it has to be very carefully curated and iterated on. But I think it's a very, very important thing, and I think it's coming. So my view is, get involved and get the project started, because it does have an impact.
Great, thanks, Phil. And we might wrap up there. Thank you all for your time. Apologies for the audiovisual issues at the start and hearing my tone instead of Phil's talking through the surgical slides. But if you have any questions, reach out to myself and Phil, and really appreciate your time. Over to Ujwal if he's online. Maybe here he is.
Thank you very much, Mark and Dr. Smart. That was terrific. And apologies to the audience for the technical difficulties we had at the start. But notwithstanding those difficulties, obviously it was a terrific session with so many great insights. So thank you very much to both of you for leading that session. We now are at the grand finale, which is the Datathon, and I'm going to hand it over to my colleague Anita to take you through what is going to happen next. Over to you, Anita.
Thank you very much, Ujwal, and it was great to hear from our healthcare experts this morning. 2 weeks ago, when I started this conference, we talked about our Melbourne Business Analytics Datathon. Our conference is always linked up with the Datathon, and this year is no exception. We held our fourth Analytics Datathon 2 weeks ago, and this was also our first virtual Datathon, where we had over 300 participants come together to help find solutions to drive recovery and growth. So the session was very well attended, and we're really looking forward to what the 6 finalist teams have to present to us today. But before we do that, it's my great delight to introduce the Honourable Danny Pearson, the Assistant Treasurer of Victoria and the Minister for Government Services and Regulatory Reform. He's a big supporter of leveraging digital and innovation and analytics, of course, to keep our communities safe and to improve economic outcomes. Minister Pearson is also currently leading multiple other portfolios, so we are most grateful that he is able to join us today at our Business Analytics Conference. Mr. Pearson is a member of the Legislative Assembly in the Victorian State Parliament, having been elected in 2014 and subsequently in 2018. Prior to being promoted to Cabinet, Mr. Pearson was the Parliamentary Secretary to the Premier of Victoria. Mr. Pearson holds an Arts Honours degree from the University of Melbourne and was awarded an MBA from Melbourne Business School. I now invite the Minister to say a few words on the role of data and digital in driving recovery and growth.
Thank you, Anita, for your warm welcome. Firstly, I'd like to acknowledge the traditional owners of the lands on which we meet today, and I pay my respects to their elders past, present and emerging, and the elders of other communities who may be joining us. It's my pleasure to open Melbourne Business School's Datathon finalist pitches and prize presentation. As Minister for Government Services, I have a strong interest in seeing that Victoria adopts a data-driven approach to deliver the best possible services and outcomes for citizens. I feel incredibly fortunate to have the opportunity to shape the Victorian Government's data and digital transformation agenda. The pandemic has reinforced just how important data and digital innovation are and how reliant we are on them. But it's also shown us our own capacity to adapt to disruption and change. Events such as this showcase the best and brightest ways that analytics and digital innovation can transform decision making. Events like this help us seize the promise of data and analytics. I was thrilled to learn that this Datathon involves over 300 participants. At the previous Datathon, I was delighted by the great work of the entrants and winners in the 2019 Sports Performance Challenge. And I await to learn how this year's finalists have used analytics to solve real problems that could impact on the lives of our Victorian community. Technology is fundamentally changing the way we live, work and interact with one another. In the words of Klaus Schwab from the World Economic Forum, the scale, scope and complexity of the transformation will be unlike anything humankind has experienced before. Emerging technologies are already having far-reaching impacts for government, the economy and the community. Of course, data allows governments, business and citizens to make informed decisions. The value of data lies in what we can do with it, how we can use it and how we can use it to affect change. None of this is new or revolutionary, and this audience knows better than most how data and analytics are helping organisations to harness their data for the best outcomes. Throughout the COVID-19 pandemic, there have been unprecedented government efforts to both keep communities safe and stem economic impacts, efforts that rely on access to trusted quality data. Data has and will continue informing the government's response in so many ways. We used it to bring the community along the journey of the public health response, and the tracking of the vaccine rollout will be a top priority going forward. Furthermore, Victoria's ability to innovate will be essential to our longer-term economic recovery. Technologies will support economic growth and the creation of jobs. The digital technology and innovation sector contribute over $38 billion to our economy each year, and it supports more than 139,000 workers across 19,000 businesses. In the last year, 15 international tech companies have invested or increased their investment in Victoria, strengthening our capabilities in emerging tech areas such as cybersecurity, artificial intelligence and data analytics. We lead the nation in startup and tech funding with more than 65% of Australia's funding market share. In healthcare, the use of wearables and virtual reality tech, telehealth and advances in biotech are enhancing our ability to tailor healthcare solutions and improve outcomes. Advanced analytics will help us develop innovative solutions for medicine, transport and the environment. In manufacturing, there are opportunities to modernise systems using 3D printing, automation, augmented reality and robotics. Citizens increasingly expect governments to deliver services that match the responsiveness and ease of private sector services. These community expectations will only grow as technology advances, and meeting them is crucial. While there are clear mandates from the community to utilise analytics for better customer experiences, we must not forget the imperative to protect and secure personal information and ensure data is ethically used. The balance between realising the digital transformation opportunities while managing risks and challenges is critical. Maintaining the trust of the community while delivering value to citizens must coexist as priorities. Government not only has that direct obligation to the public, but a duty to set the standard for increasingly powerful private companies. People need to be at the heart of what we do, and this has never been so clear than in the past year. Data-driven transformation becomes possible when everyone can travel the road together. The Victorian Government is custodian of a lot of data, but this is only valuable if it helps us make decisions that improves the lives of Victorians. Uses of data such as predictive analytics, artificial intelligence and natural language processing can deliver better outcomes across government policy and service delivery. Fresh insights into how our health, education and transport systems work emerge. Elements of safe and livable communities and the provision of jobs and economic growth can be revealed. The world has changed, and government analytics along with it. In response to both bushfires and the ongoing coronavirus crisis, government has had to quickly reimagine response and recovery efforts to emergencies. This has reinforced the importance of data for government decision making and greater adoption of data and analytics within the Victorian Public Service. Across government, data has been used to understand and analyse the impact of the pandemic on businesses and communities, and to ensure targeted and impactful responses in the short and long term. More broadly, Commonwealth and state governments are working together to ensure that analysts have the data they need to effectively drive economic and social recovery. The Victorian Centre for Data Insights, commonly referred to as VCDI, sits in the centre of government at the Department of Premier and Cabinet. VCDI is led by Victoria's first Chief Data Officer and was established in April 2017 to provide a whole-of-government focus to improve the sharing and use of data by government. VCDI partners with departments, academia and industry, and its receipt of $24 million in the 2021 state budget demonstrates our ongoing commitment to the wide use of data. VCDI has generated insights to support both Victoria's coronavirus and bushfire recovery efforts. For example, VCDI has delivered projects that provided timely, whole-of-crisis, cross-portfolio data and analytics to the Premier, Ministers and senior government leaders, informed operational decisions, restrictions and community messaging during the coronavirus crisis, and assess the impact of the bushfires on the communities, as well as inform recovery programs. The Victorian Government also recognises the value and use of government data for communities and businesses. The DHHS Coronavirus Dashboard and initiatives such as the data.vic Open Data Portal and the My Victoria Data Insights platform highlight the benefits of accessible and usable government data. We also need to realise the opportunities of e-government and the delivery of services for Victorians online. We can learn plenty from digital frontrunners such as Estonia and Denmark, who have built their reputations on transparency, trust and citizen-centric services. Both nations have achieved incredible benefits from their approaches. We've started on this path through the work of our customer service agency, Service Victoria. Through Service Victoria, more and more services are being digitised, giving citizens the ability to interact with government from wherever they are. The Victorian Government Information Technology Strategy, launched in 2016, set a vision for Victoria's digital future, and under that strategy, we've established strong foundations. We've implemented the whole of government API, Application Programming Interface platform, Engage Victoria, and the single digital presence. But there's still much more to do. Looking to the upcoming development of the Victorian Government 2020 Digital Strategy, our commitment is to a connected and customer-focused government. We will remain focused on the needs of Victorians and ensure highest quality digital services and the use of data which improves services and ultimately benefits Victorians. I'm very excited about the next phase in our digital transformation, and I hope you are too. Partnerships with academia, industry and others are key to unlocking the potential for data both inside and outside government. One of these partnerships is with the Melbourne Business School. This is a collaboration which develops professional development opportunities for the public service and real-world experience for MBS interns. Collaboration across sectors is crucial for government to accelerate data and analytics innovation. I want to thank the Melbourne Business School for inviting me to open this very special event. To all 300 participants in the Datathon, thank you for the time and effort you have applied to the competition. I applaud you for your commitment. Finally, to the 6 Datathon finalists, I'm looking forward to your presentations and wish you the very best of luck for the competition. Special event. To all 300...
Thank you for your very important words, Minister Pearson. Our Melbourne Business Analytics Datathon aims to showcase how more evidence and data-based approach can create better outcomes than intuition or gut feel. On the 27th and 28th of February, 67 teams comprised of 350 Datathon participants assembled virtually from interstate Australia, India, Malaysia, China, Indonesia to compete for their share in $25,000 in cash prizes. We welcomed 38 corporate teams and 29 student teams to mine through various data sets to find insights to help Australian businesses and government to accelerate recovery and growth for our economy. As Minister Pearson said, data and analytics need to be harnessed for better outcomes to keep our communities safe, whilst stemming the economic impact. Datathon participants received a quick briefing on the morning of the 27th of February and were given 36 hours to analyse data sets on the closed loop platform provided by Zetaris. Teams had 4 days to work on an 8-page submission for us, and our Datathon readers had the difficult task of pouring through all of the submissions in 8 hours to select 4 corporate teams and 2 student teams who will compete today at the grand finale. Many thanks to our readers, Nick Cochrane, Managing Director at Pinpoint Enterprise Solutions, Jesse Papek from SAS, Paul Chikola from Zetaris, and Professor Ujwal Kayande for their enormous effort during those 8 hours. The calibre of submissions was very high, and we'd like to thank all the participants who are watching today who submitted for their time and effort, and hope they were able to join today. So an event with 350 participants done virtually on a technical platform would not be possible without the support of our sponsors and partners. And as the Centre is now 7 years old, it's a great delight to work with some very long-term partners. SAS, of course, was the platinum sponsor for both our conference and our Datathon. A big thank you to Lynette and Ian for their continued support on this front. Zetaris once again provided our Melbourne Business Analytics Datathon platform, as they did in 2019. Thank you to Vinay, Prasad, Rod and the team for their continued support. And DXC Technologies brought us together once again with their partner, AWS, and integrated SaaS tools into the Zetaris environment for our participants to hack away over that weekend in February. Thank you, Des, Mark, Aria, and the DXC team. And of course, with all these fabulous platforms and tools, without the support of the AWS generous cloud grant, we wouldn't be able to host that event. The cloud grant powered the development of the virtual machines, as well as the hacking weekend. Thank you to Lillian and Vinny for your support over that Datathon weekend as well. And finally, of course, the Digital Delta team at KPMG. KPMG has supported our Datathon for the last few years as well, with the storytelling aspect, which we will see come to light today. Thank you, Guy, Phil, Jerry, Jenny, and team for your support during Datathon weekend and preparing the teams for their final pitch today. Over that weekend, the teams were given this exact challenge that you see in front of you. It's tied again with our conference, of course, around driving recovery and growth through data analytics. And the question posed was, how can the Australian government and or businesses drive recovery and growth using the data sets provided? As I've said many times this week, we encouraged them to use more than one data set to answer that question, and that will factor, of course, into the judge's decision today. And a datathon really wouldn't be a datathon without data providers. You'll see from our wonderful buffet of data there, Roy Morgan has supported our datathons each year by providing a data set that links in the themes from the various other data providers. You'll see there that we have both macroeconomic indicators like housing costs, employment, but we also have micro IoT data, at the level of people movement, like pedometers that the City of Melbourne captures, or Uber Media as well. We were hoping, along with a very generous donation of the data set funded by Tanara Philanthropic Advisors around government restrictions globally and the measures taken by each government, and of course the associated active cases and lives lost, the participants would be able to find us some great insights and recommendations as to how we balance that economic impact against the safety of our communities. We are grateful for all of our data providers in helping us and providing data sets that help the participants to identify ways in which we can continue to drive forward recovery and growth. So one of the fabulous things about our Datathon, through the generous support of our sponsors, is that we are able to offer quite significant prize money. So today, those 6 teams will be duking it out for their share in $25,000 in cash prizes. So the first place will get $12,500, second, $5,000, third will be $2,500, and the top student team will receive $5,000. So something to note is that the student team is also eligible to be considered for the top 3 prizes. As in 2019, our top student team ended up taking out third place as well. So keep that in mind as you watch the presentations. So the rules are there all on the screen. I'm not going to run through them all, but no external data sets were allowed to be used in generating these insights. So if you're, backseat driving there thinking, well, I would have included this and that and the other, they were only allowed to use the data sets that I showed you a few slides earlier. They needed to declare and footnote which data sets were used. And in the event there is a dispute, the judge's decision is final. And of course, MBS reserves the right to make any final decisions on the prize winners. We do have a very esteemed judging panel today, but before we dive over and introduce them, the judging criteria, like in years past, will be based on 3 criteria that you see there. Each criteria is worth 10 points, so each presentation will be judged out of 30. The students and the corporate teams spent the weekend of that datathon generating insight. They only had access to the data sets over that weekend. So that part is hopefully largely done and dusted and in their presentation. Today, we're really assessing their ability, the last 20 points, on their effective communication. Have they managed to convince our judges that those solutions will make sense to drive recovery and growth? And then, of course, even if they make sense, how feasible are they? Can people implement these innovative solutions? And that makes up the last 10 points of the 30. And again, special thanks to KPMG, the team there that took time out of their busy schedules to coach some of our teams in their storytelling today. So let's look forward to that great work. Each of the teams will have 8 minutes to present their solutions to the judging panel. And then they will have 2 minutes of Q&A from the judges, asking them, poking and prodding, how feasible is the idea? Does this really make sense? Which data sets did you use? They'll be given a 1-minute warning, and then exactly at 8 minutes, I will come back on and end their presentation. So if they're not done, that's all they will be able to say. So we encourage the teams to make sure that they have completed their storytelling by the time 8 minutes is up. We have our 6 teams waiting in the wings in our studio, and the team that's presenting, the other 5 teams will not be able to view those sessions to avoid any competitive advantage that they might be able to receive by seeing the judges' questions. So they're all coming into this cold into the studio. And there again, Mark Alexander, who we heard speak just earlier today, and our top student team that won in 2019, they also took out 3rd prize and also an additional prize from Zataris in 2019. So we'll have to see what happens today. We have a panel of very distinguished judges with us today, ready to come into the studio. We welcome Paul Chikala, the Chief Revenue Officer for Zataris, Lynette Clunies-Ross, who's spoken over a couple of days of this conference week from SAS, Amanda Good, a returning judge from 2019, Director at KPMG, Professor Ujwal Kayende, and Wendy Stops, both of whom you have seen much of during this conference week. So we are delighted to welcome the 5 of them to our judging panel. So with that, I'll let you all grab a quick lunch break or some tea, and then we will be returning at 12:45 p.m. Australian Eastern Daylight Savings Time to kick off those presentations. We look forward to seeing you then.
In an uncertain world, understanding data is more important than ever. It can help organisations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organisations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organisations to put their future into their hands.
At SAS, we love bold questions, outrageous and impossible questions. The answers are waiting to be discovered because space isn't the new frontier. Data is. And with the right questions and the right analytics, we make data do amazing things. Like make the world safer, faster, healthier, and kinder. All we have to do is ask the data, analyze it, shape it, and make it work smarter for everyone, everywhere. With SAS, you can turn data into answers and ask the questions that move the world forward. SAS, curiosity forever.
AI in the enterprise is all the rage. But put the hype aside. How are today's organizations actually executing and seeing value from enterprise AI? Dataiku is the platform, democratizing access to data and enabling companies to build their own path to enterprise AI. To make enterprise AI a reality, Dataiku provides one simple user interface for data preparation, data exploration, automated machine learning, model deployment, AI monitoring, and management. Dataiku is built for everyone with robust features for both the code-free and the code-first. From business users and analysts to data scientists and engineers, Dataiku makes working with data faster and smarter. Each company's path to enterprise AI looks different, so Dataiku supports the creation of a spectrum of applications. Whether that means building out a self-serve analytics platform or fully operationalized AI integrated with business processes. No matter what the underlying changes in architecture or advancements in technology, Dataiku remains at the center, the cornerstone of data governance and responsible AI. Dataiku's centralized, controlled, and elastic environment fuels exponential growth in the amount of data, the number of AI projects, and the number of people contributing to such projects. Dataiku, for every industry, every use case, and also for everyone. Discover your path to enterprise AI at dataiku.com.
People have got a unique thing about them, which is not only are they awesome technically, but they feel a sense of belonging. We genuinely call ourselves a family. Genic was started out of a desire to start something from scratch that tried to tackle the data market with a new and fresh approach.
Our vision is to never settle on a technology, to be constantly chasing the unicorn.
The space is moving really quickly, and we see it as our job to be aware of new things coming, and when they are good things, be able to introduce them to our clients.
Databricks is the data and AI company. We help data teams solve the world's toughest problems. They can't be solved in silos. They can't be solved by one person. We need all the data, all the science, all the brain power in one place on the only open, unified platform for data management, business analytics, and machine learning.
In an uncertain world, understanding data is more important than ever. It can help organizations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organizations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organizations to put their future into their hands.
At SAS, we love bold questions, outrageous and impossible questions. The answers are waiting to be discovered because space isn't the new frontier. Data is. And with the right questions and the right analytics, we make data do amazing things. Like make the world safer, faster, healthier, and kinder. All we have to do is ask the data, analyze it, shape it, and make it work smarter for everyone, everywhere. With SAS, you can turn data into answers and ask the questions that move the world forward. SAS, curiosity forever.
AI in the enterprise is all the rage. But put the hype aside. How are today's organizations actually executing and seeing value from enterprise AI? Dataiku is the platform, democratizing access to data and enabling companies to build their own path to enterprise AI. To make enterprise AI a reality, Dataiku provides one simple user interface for data preparation, data exploration, automated machine learning, model deployment, AI monitoring, and management. Dataiku is built for everyone with robust features for both the code-free and the code-first. From business users and analysts to data scientists and engineers, Dataiku makes working with data faster and smarter. Each company's path to enterprise AI looks different, so Dataiku supports the creation of a spectrum of applications. Whether that means building out a self-serve analytics platform or fully operationalized AI integrated with business processes. No matter what the underlying changes in architecture or advancements in technology, Dataiku remains at the center, the cornerstone of data governance and responsible AI. Dataiku's centralized, controlled, and elastic environment fuels exponential growth in the amount of data, the number of AI projects, and the number of people contributing to such projects. Dataiku, for every industry, every use case, and also for everyone. Discover your path to enterprise AI at dataiku.com.
People have got a unique thing about them, which is not only are they awesome technically, but they feel a sense of belonging. We genuinely call ourselves a family. Genic was started out of a desire to start something from scratch that tried to tackle the data market with a new and fresh approach.
Our vision is to never settle on a technology, to be constantly chasing the unicorn.
Space is moving really quickly, and we see it as our job to be aware of new things coming, and when they are good things, be able to introduce them to our clients.
Databricks is the data and AI company. We help data teams solve the world's toughest problems. They can't be solved in silos. They can't be solved by one person. We need all the data, all the science, all the brain power in one place on the only open, unified platform for data management, business analytics, and machine learning.
In an uncertain world, understanding data is more important than ever. It can help organizations make informed decisions, face ongoing challenges with confidence, and prepare for an uncertain future. The Centre for Business Analytics works with organizations to unlock the power of data so they can make factual, proactive decisions that deliver competitive advantage. Our educational programs provide powerful learning opportunities for executives looking to transform decision-making through business analytics. We provide access to a premium analytics ecosystem, which includes world-class academics and research experts, along with early access to analytics talent who speak the language of business, technology, and mathematics to drive value and navigate change. Through the power of analytics, we are empowering organisations to put their future into their hands.
At SAS, we love bold questions, outrageous and impossible questions. The answers are waiting to be discovered because space isn't the new frontier. Data is. And with the right questions and the right analytics, we make data do amazing things. Like make the world safer, faster, healthier, and kinder. All we have to do is ask the data, analyze it, shape it, and make it work smarter for everyone, everywhere. With SAS, you can turn data into answers and ask the questions that move the world forward. SAS, curiosity forever.
AI in the enterprise is all the rage. But put the hype aside. How are today's organizations actually executing and seeing value from enterprise AI? Dataiku is the platform, democratizing access to data and enabling companies to build their own path to enterprise AI. To make enterprise AI a reality, Dataiku provides one simple user interface for data preparation, data exploration, automated machine learning, model deployment, AI monitoring, and management. Dataiku is built for everyone with robust features for both the code-free and the code-first. From business users and analysts to data scientists and engineers, Dataiku makes working with data faster and smarter. Each company's path to enterprise AI looks different, so Dataiku supports the creation of a spectrum of applications. Whether that means building out a self-serve analytics platform or fully operationalized AI integrated with business processes. No matter what the underlying changes in architecture or advancements in technology, Dataiku remains at the center, the cornerstone of data governance and responsible AI. Dataiku's centralized, controlled, and elastic environment fuels exponential growth in the amount of data, the number of AI projects, and the number of people contributing to such projects. Dataiku, for every industry, every use case, and also for everyone. Discover your path to enterprise AI at dataiku.com.
People have got a unique thing about them, which is not only are they awesome technically, but they feel a sense of belonging. We genuinely call ourselves a family. Genic was started out of a desire to start something from scratch that tried to tackle the data market with a new and fresh approach.
Our vision is to never settle on a technology, to be constantly chasing the unicorn.
The space is moving really quickly, and we see it as our job to be aware of new things coming, and when they are good things, be able to introduce them to our clients.
Welcome back from that short break. It's the moment we've all been waiting for. So we're delighted now to welcome our very first student team, Happy Scots Friends. We welcome Zheyan Shi and Xiaoyue Lin to present for Happy Scots Friends.
Good afternoon. I'm Xiaoyue from Happy Scots Friends. Joanne and I will talk through our proposal of helping revive Melbourne restaurant industry with the power of data. Have you heard about the dining vouchers rolling out in New South Wales? It's an action taken by the government to stimulate the restaurant business during the pandemic. Residents aged 18 years and over can apply for $100 in the vouchers, but does this money really go to whomever needs it? Today, we're going to propose two targeted approaches, lifestyle voucher and profession voucher. The lifestyle voucher applies to a selected group of statistical area level 2, also called SA2, based on their dining out behaviors and financial situations, which aims to bring new customers to a restaurant. And profession voucher is designed based on people's career fields to encourage the existing customer back. To design the voucher, we analyzed the Royal Morgan Census and survey data, where each instance captures the demographics and survey results of an SA2. The first step of designing the lifestyle voucher is to select target restaurant categories. To identify restaurants that need support, we plotted the relationships between dining out frequency and the count of each financial statement of residents. We found a general strong negative correlation between dining out frequency and the capacity for paying bills. However, fast food restaurants are weakly correlated to financial statement. This can imply that eating at fast food is less affected by one's financial situation or, say, the pandemic. Therefore, for the first voucher, we mainly focus on supporting those fine dining restaurants and cafes. To identify target customers, we looked at the socioeconomic scale and the relationships with dining out frequencies. We found that among all SA2s, there's a weak correlation between the number of people at the C quintile and dining out frequencies. This indicates that the C quintile doesn't have a strong tendency towards or against eating out compared to others. Does it make the C quintile our new customer candidates? Let's dig deeper. Previously, we observed a negative relationship between dining out frequencies and the capacity for paying bills. So we make a correlation analysis between the financial situations and the number of residents at different socioeconomic quintiles. We found that, we found that the AB quintile's overall financial situation is optimistic. Therefore, they probably can't afford dining out even without the vouchers. On the other side, the FG quintiles facing a relatively larger financial challenge would require more subsidies to increase restaurant incomes through them. For the C quintile, there's a general weak correlation with financial difficulties, which may imply that the majority of them can't afford daily needs and may be a bit more hesitant about extra expense than the AB quintile. Therefore, combining with our previous analysis, we choose the C quintile as our target audience because we believe that with the help of vouchers, they are more likely to be motivated to bring extra income to the restaurants with a relatively small amount of budget.
It is said that Rome wasn't built in a day. Having decided to target SA2s with large C population, we recommend implementing trials first on a smaller number of SA2s to test out our theories concluded from the previous analysis. The first criterion we look at is the proportion of C groups. Here are top 50 SA2s with the highest proportions of C and a total population larger than 1,000 because they are more representative. In addition, we further narrowed down to 25 SA2s based on the least expenditure on going out. We assume this is relevant to the amount of money spent on dining out and the frequency of going out for leisure. By offering restaurant coupons to SA2 areas that don't spend much on going out, we believe that it can motivate them to go out after work, which can also boost the economic growth in transportation, parking, and retail industries. In addition to the quintile targeting solution, we also provide another voucher strategy from a profession-based perspective. Knowing what customers are interested in is vital for an incentive strategy. It should be efficient and cost-saving to deliver the proper discounts and advertisements to the correct recipients. Here we want to differentiate catering customers in different working industries so that we can adapt promotion activities accordingly. According to the correlation matrix, there are strong positive relationships between some specific industry and the categories of restaurants, which may imply their category preference. For example, business people are more often to dine in those fine restaurants or hit up a coffee shop, while people working in manufacturing and similar industries seems to be more inclined to eat fast food. This is reasonable to think that part of these patterns may come from profession constraints, such as manufacturing employees need a light meal for convenience, while business people may require regular business dinners. So rather than encourage people to change preference and try new types of restaurants, we aim to stimulate consumption based on these existing customers. Here we provide two proposals. The first one is to provide profession-specific discounts coupons. For example, first, provide commercial companies with corporate discounts for licensed restaurants. Second, organize coupon winning activities for different types of restaurants aimed at different occupations. Another one is making area-targeted advertisement professions. For example, first, distribute a coffee voucher to coffee shop voucher or fine restaurant voucher in CBD. Second, provide promotions for fast casual in suburbs that have large factories. Here are the conclusion of our strategies. In brief, to achieve the goal of reviving the restaurant industry, we have proposed recommendation in two perspectives: lifestyle voucher and the profession voucher. We believe this can help restaurants get more customers back in store and recover gradually. Based on the result, we can further improve our work by expanding the target group to more SA2 areas and classify customers into more detailed segmentation by involving gender, age, and so on. This is the end of our presentation. Thank you for listening.
Thank you very much, Scott's happy Scott's friends. I'm going to ask the judges questions.
I've got one. How do you plan on measuring the success of your recommendations should they be adopted?
Sorry, do you mean how they can be implemented?
No, once they're implemented, how do you measure that so you can prove that your theory and your strategy has been successful?
So as we are distributing the vouchers by suburbs, by SA2s, so we guess or we assume those residents who receive the vouchers will go to local restaurants. So that would be easier for us to manage and estimate the outcome of how much the restaurant business have been increased.
Great, good answer.
Thank you.
We have time for one more question if there is one from any other judge.
I've got a question. If you had access to an additional data set, what would you like to be able to utilise next time round?
That's a very good question. We thought about that. Due to the data availability, for now we are able to access the data of individual restaurants. So the whole idea of our approaches is target. So if we have more data, we want our approaches to be more targeted perhaps we can target to individual restaurants who lose money the most, for example. Yeah.
Thank you.
Thank you very much. We don't have time for any more questions, but really appreciate you making the presentation. Thank you very much.
Thank you.
Very much. Friends. So now for our second student team, we're delighted to welcome UNSW Data Squad. And today, Sibo Zhang and Blake to you two.
Hi, my name is Sibo, and we are UNSW Data Squad. We are going to minimize the financial strain of COVID. If someone says COVID crisis to me, the first image popping in my head is this. I also think about, I'm not able to bring my girlfriend to my favorite restaurant because it's closed. I didn't realize that there were over 20,000 restaurants closed during 2020. The financial is in a mess, and maybe we can do something. There's one thing we know. Restrictions controlling COVID cases could also hurt economy. No interstate travel, limit on public gathering. Look at the graph. The bold line indicates number of cases, and each streamer line in the background indicates financial strain index for different states. What does the index measure? Like things like whether people are able to pay their job, are they able to pay their bill? In short, the higher, the worse. Look at the lines in the red box. The cases is low. However, the strain is high. It is bad, and we can actually do something. We can help the state government to choose the right policy combinations to minimize economy damage. Look at the graph on the left. Each bar represents a policy. So the state government picks some of the policies, which is a policy combination. Early on, when there's no data, the government want to understand the financial impact of them. They're going to consult with economists. But now it's 2021. We have over 1 year worth of data. And then for facing such a complex problem with multi-dimensional data, a machine learning model tend to outperform experts. That's why we say at this point, we should build a machine learning model to predict the financial impacts. And that's how we actually help the state government. So here's our overall solution. Remember, there's two things we need to keep balance. Number of cases and financial impact. So here comes the government and health professional. They have done an amazing job controlling the COVID here. They're going to pick from all those policies only if they think it's COVID safe combinations. For those policy combinations, going to run through our tool, which is a policy optimizer, and figure out the financial impact for each one of them. Therefore, we can pick the one have the minimum financial impact while same COVID safe. So how does that policy optimizer work? I'm going to hand over Jake for further detail. Thank you. So let's start with the data. Firstly, we have COVID data. So we're talking about COVID cases in 3 different states, New South Wales, ACT, and the Northern Territory. We have Google movement data. So this is about physical data through movement throughout the community. We're talking about, are people going to train stations and their jobs, or are they staying at home? So these things the government can't control, so we're referring to this as fixed data. We then have the government choices they can control. So specifically here, we're talking about their COVID policy responses. The output we're trying to predict is the financial strain index. This is what Sibo detailed earlier. So the financial strain index is a number, so predicting it is a regression problem. So we tried a whole bunch of different regression models. We picked the best ones, further optimized those, and the best of the best that we found was an AdaBoost regressor. AdaBoost is a reasonably modern approach. One of the good features about it is that it can take in, whatever sorts of inputs you like. We're talking binary stuff, categorical variables, numerical, and give you good results. So we've built a model. What does it do? You give us the fixed data, you give us the government choices, and it will predict what will be the financial strain of those choices. So let's see how we can use that in a real world context. This is from a single day in the ACT. It's from the middle of 2020. There had been no cases for 9 days. This is a typical use case for our model in the sense that there had been a small outbreak and the government had increased their policy restrictions in response. So we wanted to know if you picked a different set of policy combinations, might there have been less financial strain? So we checked every policy combination that's been implemented by every Australian government throughout 2020 that was contained in our data. And that we get the graph on the left. So each column is a policy combination, and the height of the column is the financial strain that's caused by that. So on the right, in the red ones, we're talking about strict lockdown policies. Not a good idea in this context because they've had no cases for 9 days, so lockdown isn't necessary. So let's just pick one of the blue ones on the left, right? Well, let's look a bit more closely. So now let's move to the graph on the right. So there's the blue and the green ones. The ACT government picked one of the blue policy combinations, but they could have picked a green one. And if they had, they would have reduced financial strain. You might think, it doesn't look like very much, but it's quite significant. So this is roughly equivalent to about 18% of the population moving down one of the risk brackets in the financial strain index. So say from high to medium risk. We estimate this approximately equal to reducing the unemployment rate by roughly 0.5 percentage point, which I think is a pretty significant number. So, given this, how does this process work? The ACT government would have looked at talked to their health experts and asked how they should respond to the outbreak, and they would have been given policy combinations that they had determined were going to be good at restricting COVID. They then come to us and put those policy combinations through our model. Then the model will predict which one will minimize financial strain. They select that one, and then they say, well, now that we've selected that one, we've struck a good balance between COVID suppression and economic recovery, which is effectively our aim. So where to from here? Well, firstly, this model applied at the time in the ACT, but it should apply to every state in the country because they've all managed to successfully control COVID mostly, but have to manage their responses to these small outbreaks, which happen all the time because of quarantine failures. Note at this point that the benefits that we got in the ACT, we should be able to get similar sorts of benefits for all of these outbreaks that occur. So this is a pretty wide range of benefits, not just through each state, but also throughout time. The model is very flexible, as I mentioned earlier, so we can further improve the model by adding more data pretty easily. So more data from every state, but also more economic indicators, better demographic data, and also we'd be able to extend the model pretty easily so that it could predict what the financial strain will be on specific demographic groups, which allows the government to target which groups they think are particularly vulnerable in these sorts of contexts. Finally, this applies also outside of government. Say there's an outbreak and the government changes their policy responses as a result. Say you're a large retail chain. You probably want to know what's going to be the impact of this policy change on people's back pockets. Well, our policy optimizer is going to be able to answer that question for you. And also, if you do the basic extensions that I described, you'd be able to ask what the impact is going to be on specific demographic groups, and so you can target your target markets. We think that's a pretty significant benefit across industry as well. So thank you.
Thank you very much. Let's give them a hand. I do have a question, but I'll first ask my fellow judges here if you have a burning question. Then I'm going to go with my burning question. I love the policy optimizers. Really well done on the idea. But if you attended the conference, you would have heard some of our speakers talk about the difference between causation and correlation. And of course, putting things into an ADA booster essentially is putting things into a kitchen sink and trying to work out what's going to happen there. And in this particular context, the biggest issue is that some of the policies have been determined on the basis of financial strain, which you are, of course, also trying to predict. So there's reverse causality issues. And so my question to you folks is, how do you address that, or how do you propose to address that in an actual implementation of this policy optimizer?
Sure. So they might have tried to predict it based on the financial strain that had been caused in the past. But that doesn't mean that, but the thing is that they had a limited capacity to do that based on the sorts of models and the inputs that they had. So I think because we've got all this new data that sort of gives a bit more precision and a bit more under context, I think we're going to be able to make those predictions more accurately. You're right that it's difficult to tease apart the causation. One thing that you can do is that you can try and make predictions about financial strain over longer periods of time in the future, and you can also consider what the financial strain was over longer periods of time in the past, and that way you can get sort of a picture of what it's been, how it's going to evolve, and this can sort of help you tease apart exactly what the causation issues are. That's how I'd address it.
Thank you very much. We may have time for one more question if there is one. Lynette, Amanda, Wendy? No? Yeah, Lynette? Yeah, go ahead.
Quick point of clarification. I think you said ACT, Northern Territory. What was the other state?
New South Wales.
Oh, New South Wales, okay. That was my clarification question, actually, that you got a state that actually did go into lockdown multiple times.
Yes, we did.
Yeah.
Look, I think we have run out of time, but thank you so much for your presentation.
Was a fabulous 2 presentations from our student teams. So we're now moving over to our open or corporate teams, and we're delighted to welcome 4.2. Presenting for 4.2, we have Ryan Finnegan, who actually was at our 2019 Datathon, helping out our participants, and now he returns as a finalist this year in 2021, along with his colleague Max Mills, to present their solution to you. Over to you, Ryan and Max.
Hi everyone, my name is Ryan Finnegan and I'm the co-founder of 4.2. 4.2 is a startup with a mission to help subscription companies create personalized experiences using artificial intelligence.
And I'm Max Mills, a student here at the University of Melbourne and data science intern at 4.2. And I'd firstly like to introduce Aria, an AI specialist, and Isaac, the CEO of 4.2, who are both members of our team who couldn't be here today. So why are we here today? We're here today to help you understand how governments and businesses in Victoria can get the most from their investments in the post-COVID period of renewal and growth. We all know that COVID has affected everyone differently, but how? Some of my friends found themselves locked down, alone, out of work and anxious. Contrast this to my grandfather, who was locked down in a regional nursing home, unable to come back to the city to visit his family. Now, obviously, my grandpa's recovery is going to look different to my friends. What Victoria needs is tailored support and investment for a fast and equitable recovery.
Before we dive into our results, let me tell you about how we approached the problem. Our strategy was first to explore the data and then to segment different localities. Then we could prioritize these localities and find the best actions for each. During our exploration of these data sets, we discovered a variety of scopes and granularities. Taking a hint from Anita, we looked for anything we could join to postcodes or localities. Next, we created a rich profile of each locality. This allowed us to segment these localities into clusters based on their similarity. Thirdly, we prioritized each of these segments based on their population size and their COVID impacts. Finally, we created unique actions for each segment based on their common features and context. Segmenting every locality in Victoria was quite challenging, but we believed that it was impossible for governments and enterprises to deal piecemeal with these localities. So briefly, I'll walk you through our method using the financial impact score as an example. Recall, though, that we used the same method for mobility, well-being, and remoteness dimensions too. The first thing we do is create a scoring function. The scoring function takes as inputs one or more of the data sets and produces a vector that characterizes that locality. Next, using unsupervised clustering techniques, like the k-means algorithm, we group similar localities together. For example, every locality with no change in house prices and a low reported financial impact would be in the same cluster. Finally, we bring these 4 dimensions together by collating them into a 4-dimensional segment identifier. The largest and most interesting segments have the highest priority. For those of you playing at home, we've grouped similar localities together. Every locality is now uniquely assigned to a segment. But why is this important? Because it means that business and government can offer tailored opportunities to each segment, from the country to the suburbs and to inner Melbourne. And for the rest of this presentation, we'll deep dive into the most interesting segments and discover how government and business can tailor their investments in each.
So the first segment that really jumped out at us was regional areas struggling to restart post-COVID. What really stood out about this segment in particular was the ageing population. So from the census data, we saw that there were far fewer younger people and many more people over the age of 65. Mobility for these people has crashed since COVID, as we can see from their trips to Melbourne, and has not recovered. With that in mind, we propose a strategy of igniting local activity by developing cultural attractions like arts districts in regional centres, as people were previously travelling to Melbourne for these experiences. We also propose employing people in government departments in these areas to bring back a youthful population and investing in mobility services for the elderly. The next segment we looked at was unhappy and unequal eastern commuter suburbs. In this segment, which includes places like Cranbourne, Dandenong and Ferntree Gully, we know that many of these people are financially well off, while many others are struggling. We noticed a strong correlation between areas with high levels of remote work and high income. We noticed a strong correlation between localities with the lower levels of remote work and high stress. Therefore, people who are suffering from stress and anxiety may have lost income from already low base. From the Roy Morgan mobility data, we know that people from these areas frequently visit Chadstone Shopping Centre. Because of this, our action plan features a mental health program in Chadstone to target these people who have suffered. Due to the high number of pubs and clubs in this segment, in areas of poor wellbeing, we've identified a government program that can be rolled out in these venues, as you can see in the action column. Finally, financial literacy programs can be an important driver of recovery for those with low savings. So the next cluster we've looked at was the struggling inner city, where we plan to transform the hospitality industry. These are places like Fitzroy and Collingwood. And although these people have high incomes and high levels of remote work, they're also a relatively young population and are suffering from poor health and wellbeing scores. Taking a step back from the data for a second, I know that I would live in a small, expensive Fitzroy apartment because of the proximity to bars, to music venues, and to the nightlife, all of which were closed during 2020. The investment opportunities here are strong because of the high levels of disposable income. We think there's a case to be made for turning unused office spaces into new pop-up stores and co-working spaces, and for new, innovative, fresh cafes and restaurants to open for the work from home professionals.
Back to the suburbs now, and it's not all doom and gloom. Some areas like Doncaster have actually done quite well through 2020, and we can help them adapt to a new normal. In areas with high numbers of essential workers, people have retained their ability to earn and spend. Additionally, their mobility has recovered much faster than average, and there are many more young people in this segment. Because people in these localities have high spending capacity, our suggestion here is to help them engage economically with the rest of Victoria. There are opportunities to cater to these people with new dining venues, to employ them in their businesses, and to bring them safely back to the CBD and elsewhere. Finally, we're going back to the country, and this time to the towns that have done well in 2020. In this segment, people are nearly back to their pre-COVID levels of activity. Places like Ballarat have seen significant increases in house prices as people move there from Melbourne. And while there are many cafes, there's also many fewer young people. What we suggest in these areas, because of the changing demographics and faster recovery, is opening trendy shops, investing in the services needed by an older population, like medical services, and developing real estate for tree changers and the elderly. We've developed a comprehensive action plan that synchronizes action across health, lifestyle, and financial facets. This synthesis is a menu of opportunities across a 2-year time frame that shows how government and business can collaborate in order to get the best outcomes. Thank you.
Very nice presentation, Ryan and
Thank you.
Max. Could I ask the judges if you have questions?
I've got a question.
Terrific. Go ahead, Amanda.
How did you group together the similar localities?
That's a good question. So basically what we did is we looked through the data initially to find like what were the interesting things we could actually measure. And then for each of those dimensions that I talked about, we scored and clustered every locality in Victoria. So for example, on the financial score, we had a bunch of different data sets which had different measures of financial impact, like for example, the change in house prices or the time to sell a house. And basically, if you had no change in your house prices or your house prices even dropped, we kind of put you on one end of the scale versus the other end of the scale if your house prices went up and your self-reported level of financial impact also went up. We sort of put you in a different cluster. So basically an unsupervised learning technique on different measures.
Thank you.
Any other question? We've got time for one more question. There is. We don't have to ask questions. Might have been very clear. Well, thank you very much, Max and Ryan, and good luck.
Thank you, Israel. Thanks, everyone.
Thank you very much to Ryan and Max from Team 4-2. We're now delighted to welcome our second team from the open section. We have the Data Maniacs who will share their solution. We have Ali, a former MBA graduate from our program, as well as Jeremy Forbes to present for Data Maniacs. Welcome to Jeremy and Ali.
Hi everyone, I'm Ali from Team Data Maniacs. We are a group of data scientists from ANZ, and we are here to present our solution, DOC, the Delivery Optimization Calculator, which is aimed at helping restaurants in Victoria recover from COVID. 2020 has been tough on all of us. Consumer behaviors has been changed forever by the lockdowns. Restaurants were among the small businesses that were hit the hardest as a result. And we think a majority of our restaurants were not prepared for the scenario where customers can't come in and dine in. And that's why we think delivery was recommended by the experts from the industry to save the day. However, a lot of restaurant owners are still not ready to make the decision around moving to delivery and reach their customer in the new normal. According to Google Movement data, on average, we saw reducing time spent eating out and increasing time spending at home as compared to pre-COVID baseline. Well, I, for one, can vouch that inside was my couch potato experience during COVID. So that means restaurants will need to update their operating procedure to increase off-premises sales through delivery so they can adapt to their customers and improve their resilience to future scenarios like this lockdowns again. On the other hand, not all customers will behave the same way. A good customer engagement strategy should not be one thing fits all. So for loyal customers and customers from competitors, restaurant owners to encourage them come back on premises and dine in so they can return the foot traffic. Well, for your incremental convenience seekers and first timers, we recommend grow through the delivery capability. So that way restaurants can reactivate their existing customers and grow additional revenue. So with all that being said, the decision of adapting delivery is not an easy one, and delivery is not for everybody. So that's where Doc comes in. We think our solution can be a government application that uses data analytics to help the restaurants. So ultimately, Doc will recommend a restaurant whether they should be delivering or not, based on identifying the right customers and where they are, as well as the size of the opportunity in the location, and with the ability to compare different delivery options. So restaurant owners can then make a data-driven decision rather than gut feel about moving into delivery. So now I'll pass on my teammate, Jeremy, to talk about the solution in a bit more details.
Thanks, Ali. So our prototype learns from regions' characteristics to predict the number of delivery orders that a restaurant could capture if they started delivering. What you're looking at on this slide here is our solution design. So starting from the left-hand side, the first thing we did is we stitched together 3 different data sets to create a curated data set. This data set describes the characteristics of each region, each SA2 region to be specific, in Greater Melbourne. A critical measure that we calculated is the market size for food delivery split by different restaurant types. We calculated this by using the population, percentage of people who have ordered any delivery food, and the percentage of people who have consumed that type of food on premise. The 4 different restaurant types that we've defined are in line with the Propeller AI dataset, and these are pubs, restaurants, fast cafes, and slow cafes. For each of these restaurant types, we've trained a separate machine learning model. Each is to predict the market size for food delivery for that particular type of restaurant. So now you think you're an owner of a restaurant and you're considering going for delivery. What you'll do is you'll input your restaurant information into Doc, and the first thing that happens is that Doc will match your restaurant with regions nearby that are a potential match for delivery, meaning they are a good candidate to look into whether or not you should deliver there. We do this matching on the basis of proximity, affordability, and consumer interest. For each of those matched regions, we will then predict the number of monthly delivery orders that your restaurant could capture if you started delivering to that region. You can think of this as a kind of market simulation exercise where we will predict the market size if you enter versus the market size if you don't. The predictions for each of these regions are all brought together to ultimately give you an indication of how many monthly delivery orders you could expect to receive and our recommendation of whether or not you should go for delivery. So this is what Doc looks like. On the left-hand side, you'll enter the characteristics of your restaurant, and the right-hand side would then be populated with a recommendation of whether or not you should deliver, a breakdown of the predictions of delivery by different regions in the map, and then the overall number of delivery orders you can expect each month. So let's bring this to life with an example. Looking at the McKinnon Free Range Charcoal Chicken Shop, which is actually a chicken shop that I grew up just around the corner from, you can see the average price for one for this chicken shop is $15, and they're interested in using Uber Eats as their delivery platform. The delivery platform is actually something that you can toggle with to see how the results change. The recommendation for the McKinnon chicken shop is that they should go for delivery because we see if they deliver within 5 kilometers, they can expect to get around 340 monthly delivery orders, which equates to about $3,600 of revenue each month after already removing the delivery fees. The map that you can see on screen shows right in the middle the location of the restaurant and the surrounding regions that are shaded. These were the ones that were matched with the restaurant, and the deeper the green color, the more predicted monthly orders that come from this area. So we'll have a look at another example now. The Firehouse Hotel, which is a more expensive restaurant in Ringwood. The recommendation here is that this restaurant should not go for delivery. If you have a look at the map, you'll see that there are only 2 regions that were matched as being potential candidates, and for each of these regions, the prediction of monthly delivery orders is 0. This is a really important case to emphasize because Doc can distinguish between restaurants that should and shouldn't deliver. We know delivery is not for everyone, so you shouldn't be going blindly into delivery. Doc can help make businesses make better informed, data-driven decisions about their delivery strategy. So we have done a bit of thinking about how we might roll this out. The first phase would involve productionizing our POC into a web app. We would then move into an individual consulting type model where a short list of businesses that were in particular need would get access to the service. And this would be coupled with some other government initiatives around support for setting up delivery and digital enablement. And the final phase, which would be a public release to all restaurant owners, would require the model to be integrating a real-time data feed that would include information around platform usage and changes in the market. So I'm going to stop there. Thank you so much for listening to our presentation, and we'd love to take any questions.
Thank you very much, Ali and Jeremy. Can I ask my fellow judges questions? Yes, you do.
Yeah, I have a question. You kind of answered it at the end because I'm starting to think, how often are you checking into this app to see whether your delivery decision should change? And then you started to talk about real-time data. Can you help me connect the dots on that?
Yeah, so currently our prototype is tailored for a restaurant that has not yet started delivering. So we're really trying to scope out the size of the opportunity and the areas where they should target if they do decide to deliver. So something that we would want to build in that last phase is that feedback loop that's going to allow restaurants to incorporate real-time information about how the market's changing. So this particularly has to do with competitors, because if, based on 3 months before, maybe it was a very different scenario. So we would be working on integrating those things into the model so that you could get a better picture of what's happening right now.
Thank you.
Here you go.
No, look, I just want to say fantastic, right? But one thing that just stood out to me was the delivery options, right? You've got multiple Uber Eats and so on. We all know that these delivery platforms, they actually are not very, financially viable for some of these smaller operators who decide, look, I'm not going to do delivery. What sort of financial modelling to give them a best, option for, recommendation for best option for delivery are you doing, or have you considered that?
Yeah, so for all the options we're presenting, not only just including all the delivery platforms that are existing, we're also offering the option for restaurants to enter their self-delivering option, which is they can think about setting up their own delivery by themselves and think about the cost on that. So then the calculator will take that into consideration. But on the other hand, we also did research. We understand government currently have some business enablement programs in place, which is about digital maturity. So then those grants can come into this program to help them set up their delivery setup, as well as help them with the training later on that needed for the restaurants to have. So we think government's existing program can be well integrated into our prototype in terms of funding to help them set up. But then later on, I understand your question where the cost of delivery platforms can be 30% to the revenue. So that's something we will take into consideration, the calculation when we recommend to restaurants. Yeah.
Thank you.
Thank you very much. Amanda, quick question.
Yeah, great job. If you could have more data from the McKinnon chicken shop, what data would you want to have from them and why?
So the main thing that we would want to know as a user of Doc is we would want to be able to get feedback from restaurants after they've used our service. So regardless of whether their decision is to deliver or not, we would really love to be able to get some feedback from these restaurants to know, did they grow afterwards? What was their split of takeaway, dine-in, and if they do deliver, delivery? I think that's the kind of stuff that we would really love to have the opportunity to integrate into this prototype so that we could have that more real-time aspect and get a better picture of what's happening day to day in these restaurants.
Well, thank you very much, Ali and Jeremy. Really appreciate that, and good luck.
Thank you.
That was great. These teams just keep coming up with great solutions. So the next team we're delighted to welcome is Netty. We have David Leung presenting. He's also a Master of Business Analytics graduate from our fine school here. And we have Hui Jun Heng presenting on behalf of Netty. Over to the two of you.
Thank you very much. Okay, yep. Hi everyone. Is it working? Hi everyone, my name is David, and together with Huijun here, we're presenting on behalf of Team Neti. Now, today's topic is very close to me, and I'm hoping it's also very close to you as well. In fact, it's can working from home, yes, working from home, actually drive economic recovery and growth? Great, so a little bit of the agenda today. I'm going to be going through a bit of the introduction, followed by our recommendation. And our recommendation is going to be that we propose developing an optimized rostering work from home system. Finally, Huijun here is going to go through a bit more about the benefits. So taking a step back into 2020. Now, we went through 2 lockdowns. That's not great. And what we can start to see from the data is that people actually start moving away from the cities as we started working from home. You know, we got used to this, but now fast forwarding to 2021 right now, people are starting to move back to cities as people are getting back into the office. However, there have been actually quite a lot of benefits from working from home, both from the well-being side of things and also from the economic side of things. Economically, we've seen that people have been moving into larger houses as they need more space. But on the retail side of things, especially in suburban areas such as the Chadstone shopping mall, we've seen that retail foot traffic has actually doubled since pre-COVID levels, which is great. On the well-being side of things, we've all noticed that while we were working from home, there have in fact been a lot less drivers on the road, which means less traffic, which means more time for us to spend on the things that we enjoy doing. Now, our proposition here is that essentially if the Australian workforce returns to full work in the office model, the progress that we've made towards both those well-being benefits and economic benefits will start to be deteriorated. So our solution and what we're recommending and what we've done is we've developed an optimizer. So we want to create an optimized work from home roster, and we hope that you do as well. What this means is not that you can work from home any day of the week, but you have a rostered system when you work from home. And on this slide, we're presenting 3 guidelines, which can be tailored to your business, followed by I'm going to go through a very simple roster and how this can work. So number 1, we want to reduce the risk of COVID spread. And what this really means is that not everybody is going to be working in the office on every day of the week. Also, not all teams are going to be working at the same time together. Now, this has to be balanced by guideline number 2. And guideline number 2 says that we still want that good collaboration. We still want those great social benefits that come from working to office and working in person together. Finally, we want consistency in office hours. As I've mentioned before, it's not that you can choose whenever you want to work from home, but you have this consistent roster of when you should be coming into the office. Now, on the next slide, what we have is a very simple roster that we've created. We only have 5 teams, but this can be optimized to do 100 teams, right? And we've also targeted a capacity utilization of 60%. It's very simple again, in terms of that it's a 3 days in the office, 2 days out of the office model. And how it can work is, for example, team 1 works Monday, Tuesday, Wednesday. Team 2 works Tuesday, Wednesday, Thursday, and team 3 works Wednesday, Thursday, Friday. We can see how this starts to work in the sense that it's very simple and consistent when communicating with your colleagues, because we all know when everybody is going to be working from home or when they're in the office. Secondly, every team will have 1 to 2 overlapping days with every other team. And this essentially balances the risk between collaboration and the risk of any virus transmission. Finally, we still want to make sure that similar and interdependent teams are working very closely together. For example, if your analytics team and your business team is working closely together, they can be placed as team 1 and team 2, where they in fact have 2 overlapping days compared to other teams and other combinations which have only 1 overlapping team. That's an example of our rostering system. And now I'll hand over to Huijun, who will tell you a bit more about the benefits, both economically, to businesses, and to us as individuals. Huijun?
Thanks very much, David. I'd like to talk today about the 3 key benefits we will receive from working from home under this hybrid model. So first of all, we've already seen great recovery in the suburban level. So we want to maintain the work from home conditions so that this recovery does not stymie and actually can be translated into growth in the future. This is very important because the majority of businesses are actually not located in the CBD. So we want to have the support for these businesses by continuing to work from home in the suburbs. And should we ever, go back to 100% work from home, we'd actually risk the loss of this improvement and also cut 90% of businesses away from their customers in this most crucial recovery time. Next, we saw that the work from home study has actually been very well researched, and existing companies have used this for many, many years to improve productivity, improve job satisfaction, and reduce business costs. So because the topic is so well covered, we wanted to include some of the existing qualitative data that not only informs our presentation, but also many the actions and plans of multinational corporations worldwide. On this slide, you can see some of the most consistent findings in the last 25 years of research. And we hope that with the work from home hybrid model, this will become the new norm for Australian businesses in our country. Thirdly, we individuals definitely can save a lot of time in traffic with the work from home hybrid model, because we're not always going into the office, and we'll have a lot less traffic to contend with when we do. We've taken the traffic data and done some scenario analysis, and we found that under current circumstances, with most people still avoiding public transport, it's not a good look for traffic going forward, as it's set to increase maybe 13% over pre-COVID congestion, which is really bad news for everybody being called back into the office. However, if 20% of if 20% of Australians were able to work from home, then we could see a 17% reduction in this traffic. With 40% of Australians working from home, this benefit goes up to a 48% reduction and really gives us all those hours spent stuck in traffic back into our homes and our lives. So employees also tend to reinvest the time that they save from commuting and being stuck in traffic into chores and paid work, thereby benefiting both themselves and their families. In conclusion, we really believe that the work from home hybrid model is going to be the best way to revive our economy at the national level as it spreads the business recovery across a larger region. We feel that the Australian government is very important into supporting this transition, as they can definitely invest into optimization tools and guidelines that help businesses work out the most optimal roster for their team. And on the company level, businesses can then take this tool and fine-tune it to their own unique requirements, thereby reaping all the benefits that we've listed in our presentation. Finally, each and every one of us will really be able to win back so many hours every week, not being stuck in traffic or with reduced commuting times, and ideally spend this time with our families or on our health and on our well-being. Thank you very much, Melbourne Business School, and thank you everyone for joining us.
So thank you very much, Hui-Jin and David. I'll pass it over to my fellow judges.
The example you gave was 5 teams, and you talked about how you could optimize this for large organizations. What did your analysis show you around those larger organizations? Because it becomes more complex when you're trying to get multiple groups in a very large organization.
Yes, that's absolutely true. And the example was just a sample for presentation purposes. Whereas what we can do, and it's quite simple, even using Excel solver, is that you can up the number of teams. As in the slides that I'm presenting now, you can have 5 teams, you can have 10 teams, you can have 100 teams. And the whole point of using an optimization model is that you can put in all of those constraints, or even up to those 100 teams, and you can reap the benefits. This is something that you can't do when you're manually placing each team.
Thank you, David.
Yeah, I didn't catch what your sources of data were at the very beginning. Can you help me with that? I'm interested in how you choose teams for collaboration in your model.
In terms of choosing teams for collaboration, I think that will be on a very company specific. For example, as I mentioned, like you have similar teams working together, you can set a constraint where you want the number of days that those 2 teams work together equal to.
And what sort of source data would you seek from a company to do that?
I think this would be team level to try and define those rules and parameters. Just like any other optimization model, it has to be tailored in order to deploy.
Okay, thank you.
Thank you very much, David, and thank you, Huijin. Thank you very much for your presentation. It's been terrific, and best of luck.
Can't believe it's already time for our final team for today. So the fourth open corporate team to present is Talk of the Town, and they may well be the talk of the town after this is well done and said. We have Jianan Wu and Neha Raniga to present today on behalf of Talk of the Town. Over the two of you.
Testing. A very good afternoon to all of our distinguished guests, judges, to all conference attendees. We are ANZ's Talk of the Town, and you will soon see why. We were presented with quite the challenge. How do we stimulate the economy amidst this coronavirus pandemic? Well, we will present our solution, stimulating local movement and economic recovery through LAMP insights. Firstly, the crisis that unfolded. The left in red tells the story. We had cases which led to lockdowns, limited movements, spending cuts, job losses, and the economy suffered. On the right in green, our path back to recovery. Intuitively, we know that if we increase movement, there'll be more spending and it will be better for our economy. But do we see the problem here? Our team quickly realized that movement is at the crux of everything. Movement can either lead us to success or it can lead us to a vicious circle of economic decline because of cases spreading. Therefore, logically, our question is, how do we stimulate the economy, but in a safe way? We believe we can do this. Our proposition is to use a data-driven approach. We want to target the most highly impacted areas and industries. We want to provide tailored solutions, incentives to get people to support their local businesses. And Talk of the Town have also created a prototype tool called LAMP to support this, location and movement via ping. Here is an example of our LAMP insight. What we've done is we've taken smartphone ping data, which represents movement volumes in between areas. This is a sample data that we got for January 2020. The thicker the line, the larger the movement more volume. Why is this goal though? Well, in this environment, we want to encourage this sort of movement in green because it represents movement within local areas. But our LAMP insights can be used to identify areas with movements that we may wish to avoid, long distances or where there are COVID hotspots.
In order to dissect our problem, we have taken a three-step approach. First is exploring the data. We hope to create a solution that links a diversified set of data using as many datasets as possible so that we can exemplify idea in an innovative and realistic way. On the left here is all the datasets which I've used. The second step is to leverage this data to check for trends and patterns between datasets. We hope this will provide us guidance on the direction which we will face. And last of all is crafting a solution. We'll propose the data-driven area and industry-specific recommendations, and the execution of the recommendation will be monitored by a LAMP insight prototype. You can see here on this graph that this is why we want to promote localized movement. As movement rises, the impact on the economy generally decreases. However, with the ease of restrictions and under the current global pandemic environment, too much movement can also leave our society more vulnerable in front of any further outbreaks. As you can see on the right here below, that the word purple indicates number of cases and remaining indicates the movement. You can see that after the ease of policy restrictions after July last year, there's a steep increase of movement. However, it's shortly followed by a steep increase of number of cases after some incubation delay. And this is what might happen if not enough control is in place. So where should we start? Australia is huge and prioritization is key. We have focused our lens on Melbourne, a caged and impacted city. Why Melbourne? You can see here on the average percentage change in workplace movement against pre-COVID baseline, where Victoria is highlighted in blue and remaining of Australia is highlighted in red, and lower on the y-axis indicate a more negative effect. You can clearly see here that Victoria has suffered a greater lifestyle impact compared to remaining of Australia. We further prioritize within Victoria using the Taylor Fries Financial Index. Here we want to target the most impacted and the most populated areas to maximize the effectiveness of our strategy. You can see here on the graph, each dot represents the area, and on the x-axis is the financial impact score. Further towards the right means you're more financially impacted, and on the y-axis is the population. Here we have highlighted the top 50% in both impact as well as population. We call this our targeted quadrant. We have mapped this onto a geographic representation. Here, still, each dot is an area within Victoria, and those which are in the target area are highlighted in color. You can see that most of the target areas falls under the Greater Melbourne region, which in fact is 83%. And this is why we picked Melbourne as our starting focus. How has Melbourne's life been impacted? Here you can see in the moving average of the percentage change in movement of Google's movement data for City of Melbourne. All the activities decreased, yet residential activities in blue increased. And this is our problem which we want to tackle. How can we promote movement? How can we build confidence in people such that in an efficient, effective, yet controlled way to avoid any further outbreaks?
And now we have reached the part where we can use data to incentivize movement. The best part is that these are tailored recommendations for every area. Folks, the data is rich. We can tell so much about these areas, about the demographics of the people that live in them, about their business compositions. Take our 2 sample suburbs, for example. These are suburbs that we highlighted as the highest impacted and highest populated earlier. Now, North Melbourne has about half the population of Melbourne CBD, but almost twice the average household income. We can infer from this that they have a higher disposable income, which is reflected in the higher weekly expenditure. The key message from this slide is that no 2 areas are the same. We need to keep this in mind when coming up with initiatives. On our final slide now, we have created example recommendations based on our suburb profiling earlier. So for example, North Melbourne, we could have food and beverage vouchers issuing $25 to subsidize every $90 of spending. This is in contrast to the figures in Melbourne CBD because they have a lower household income and expenditure. So there's so many different ideas that we've got on the page that you can use to get people to support their local businesses. And where does LAMP come in? Well, we have to use LAMP to understand how broadly do we want to target the initiatives in terms of areas. Do we open it up to local neighborhoods? And we are estimating $1.9 million of economic activity can be generated with just a conservative uplift of 10% in spending leisure. So what have we done as a final recap? Well, we've used data to understand the highly impacted areas. We used data to understand the suburbs, and we've used data to understand how can we monitor movements in these areas for our initiatives. Thank you.
Thank you very much. So, Janan and Neha, I'll ask my fellow judges if they have questions.
I've got a question on the pre-COVID data. Was that January only, or what consideration was given in what was representative there?
Sorry, can you please repeat which data?
So you said that you were contrasting what happened during COVID with pre-COVID data?
So is it this slide here?
It was earlier on in the presentation.
Earlier on in the presentation, Janan, where you talked about pre-COVID data. We're just interested in understanding what the benchmark was.
Oh, okay. So that benchmark is created by Google. So they created benchmark of themselves. So the data we have received is already a percentage movement from that.
And that was based on January in 2020?
I believe it is based on before the COVID start. So it'll be January.
Okay.
They called it the pre-COVID baseline, actually.
Okay, thank you.
Thank you very much.
I have a question. How did you estimate the $1.9 million uplift per month?
Yes, because we have a lot of components which we have to consider during this, and we don't actually have enough data to create a very effective budget. So we set a high level that we will estimate 10% increase of the leisure activities, and we got the leisure activities from the Royal Morgan data for those areas. So we assume that our recommendations will overall increase 10% of the leisure activities.
Thank you very much. We have run out of time, but a terrific presentation, and thank you very much for your efforts. Good luck.
Thank you. Thank you.
Thank you, Jianan and Neha. Jianan is, of course, another wonderful graduate from our Master of Business Analytics degree program. So the judges now have a tough choice. They're heading to a quiet room to make their final decisions as to who should take out parts of the prize money. First prize again, $12,500. So we'll take a short break and be back again at 2:10 p.m. to announce the winners of this year's Melbourne Business Analytics Datathon. See you soon. Well, welcome back, everyone. It was a really tough call, which is why it took a little bit more time than expected. So I know that the judges had a tough time, but we do now have 4 winning teams selected for the 2021 Melbourne Business Analytics Datathon. It's been a long journey to get here, and it's my delight, first of all, to bring up Ms. Wendy Stops, the chair of our Industry Advisory Board, who will be presenting the student prize. So the winner of the student prize for the 2021 Melbourne Business Analytics Datathon is UNSW Data Heroes. Welcome. You want to say some words, or are you all good? Thank you, Wendy. And now on to our top 3 open teams. So I'd love to bring forth Amanda Good from KPMG to present third prize today, $2,500. And as I said, a student team can also be considered for the first, second, and third prize, which I mentioned earlier today. So again, it is the UNSW Data Heroes taking out third prize. Now, do you have any words?
Thank you very much. Really appreciate it.
Awesome. Cheers. And the team really did come down from New South Wales just to be here in Melbourne studio today. So thank you for coming down. And now we're down to the last 2 prizes. So the second place team will take $5,000. And it's my great delight now to bring up Martin Ferrantonio from Zataris, who is new to the organisation as the VP of Alliances at Zataris. So he will be presenting the Zataris Best and Fairest Prize, which is also second prize this year of $5,000. So again, as I said, the judges had a really hard time with this decision in determining between first and second. And they decided ultimately that the second prize should go to 4-2. Thank you to Zataris for their support for a second year of our 2021 Melbourne Business Analytics Datathon, and it's great to see Ryan returning now as a participant and taking out a prize. So now we're coming down to the wire of the very last team, the first team today that will take out the $12,500. So as I said, again, really tough decision for the judges, but the first prize, and I was just saying I wish we had a drum roll here, goes to... We have to bring up Lynette first. Let's hand over that big check to Lynette Clooney's-Ross, our big sponsor from SAS, to present that big prize. A big check takes up the entire screen. And the first prize for the 2021 Melbourne Business Analytics Datathon goes to the Data Maniacs from ANZ. As first prize winners, any special words, Ali and Jeremy?
Well, thank you so much. We really appreciate the opportunity, and we really appreciate the support we had from ANZ giving us the opportunity to join this and also have some time in lieu afterwards, which is pretty awesome. Yeah, again, shout out to our team who are not able to join us. Yeah, very excited. Thank you so much. Yeah.
Congratulations again to our team from our partners ANZ, Jeremy and Ali, representing the team Data Maniacs. Thank you so much for coming in today, and thank you to all our teams for coming in to present today and participate in our Datathon. We were really happy to have you in studio and that we're in the position to host you in our studio today. So this is a bittersweet moment for me as conference chair. We sincerely hope you've enjoyed this week's conference that we've put together for you, and it has given you some inspiration, I hope, as to how data analytics can drive recovery and growth and keeping us all safe in the meantime as well. But before we conclude, there are quite a few people that I do need to thank. A ginormous week like this certainly doesn't happen simply by chance. So, of course, first of all, I'd like to thank SAS for their continued support of both the Centre and, of course, our Business Analytics Conference and our Datathon. Thank you, Lynette and team. And, of course, our other sponsors as well, Data IQ, IBM, Yellowfin, NAB, Agenic, Databricks, SPP, Suncorp, and some of them, as I said earlier, returning sponsors, as well as some new sponsors in there as well. So thank you for your support of our Centre and our conference. And also, like with ANZ, our corporate members who do support the Centre in what we do, we are very grateful, and we wouldn't be able to hold world-class events like this without their support to bring in those international speakers and bring in such a large crowd as well. So thank you for your support as well. And of course, to our 50+ speakers and judges and everyone who's helped to make this conference and the agenda such a wonderful success, thank you all very much as well. So over the last few months, our very lean centre has truly been riding on the shoulders of champions to deliver this conference. So I wanted to first off offer my own undying gratitude to our centre coordinators, Arita Economo and Jacinta Silva, along with Kit at Vumero, for their momentous efforts in pulling together this virtual conference week and Datathon. A huge thanks also to our entire tech crew behind the scenes who've helped us look fabulous this week and stepping away from their normal day jobs. Simon, Dylan, Jim, Justin, Christian, and Mark, thank you for making it all seem seamless. And to the entire MBS marketing technology facilities, thank you for your efforts in the smooth delivery of this conference. And of course, a personal thanks to Professor Ujwal Kayende, the Director of the Centre for Business Analytics, for the support and trust that he's given us to deliver this event and do it virtually, our very first inaugural Business Analytics Conference week. So it's fabulous to have your support in creating this conference. So we do encourage you all to get in touch with the Centre should you need help in any way with data analytics. And all of this week's sessions will be available on demand, and you will be receiving a link very shortly that you'll be able to just follow up with all the sessions that you may have missed. And stay tuned, very shortly we'll be coming up with a 2022 Business Analytics Conference Week date for you. But we hope to be face-to-face by that time, but wishing you all a great rest of the week, and we look forward to seeing you all again very soon. Thank you.